Hello, and welcome to our Tuesday evening workshop. Thank you all for being here. We have Gordon Smith along with guests. If you can introduce yourselves and then please proceed. I'll ask counselors to hold questions until we're done presenting with everyone.
Do we need to turn the mics on?
No, we should be good to go, but you need to move them quite a bit closer to you than they are now.
Okay. All right. Well, thank you. And I'm here from the Governor's Office of Policy Innovation and the Future we call it, and I'm the Director of Opioid Response for Governor Mills. I think before proceeding, I'll have Ann Seitz for the CDC introduce herself, and then Catherine and Ernestine too, and then we'll have a second panel before we start taking your questions.
Hi, good afternoon. I'm Ann Seitz. I'm the Director of the Infectious Disease Prevention Program at Maine CDC.
Good evening, Catherine Ryder, Senior Director of Strategic Initiatives at Spurwink, and some of you may know me as the former CEO of Tri-County Mental Health Services before we joined with Spurwink.
Hello, I'm Ernestine Peralt, and I'm a supervisor at Spurwink of the Community Outreach Programs, which encompasses 9 grants.
First of all, thank you for having us. I think we've all had an opportunity to see the proposed ordinance, and we've had a few days to look at that and to prepare some remarks for you tonight from a variety of people, and then we'll take questions at the end so that not one of us gets peppered with all the questions. I'm a lawyer, but in my current role in the Governor's Office, I really function in the policy area more than the legal area. I want you to know I'm no stranger to Lewiston. I grew up in Winthrop, just, what would you say, 18 miles up the road. Growing up in the 50s and 60s, we'd come here and shop at Peck's at Christmas time. It was a time when, people came to the city to shop. My dad had a little 5 and dime store just across the bridge in Auburn on the left. I actually think maybe the city offices are there now. It was called Wilson's Dollar Stores, but none of you are old enough to probably remember this. We also had a store in Norway, and so we'd come with the store truck and we'd stop in Auburn, go over to Norway. And, Central Maine was a wonderful place to grow up in. So I've been in Maine all my life. I've graduated to East Winthrop from Winthrop, and still come to Lewiston a lot, and love your city. And we want to very much work with you with the problems that you've identified that the ordinance is trying to remedy. I came over when Mayor Shalem was first elected. We had a mayor's task force, as you may recall, to work on the opioid issue, and we had city administrators, the police chief, Catherine, wonderful group of people, and we met in person. I came over every month at the mayor's request, and we did great work over that year's time to identify what some of the gaps were and what some of the assets were. My job tonight is pretty light, really. It's to kind of set the tone to deliver the strong message from the state of Maine and the CDC and the Governor's Office that we want to work with you on this issue, that we appreciate the issues that you have identified of syringe waste, of open drug use, of the issues that are created in your downtown environment, and we want to work with you on that. And that, to us, is one set of issues. The other set of issues is we don't want to pull back and do harm to our existing harm reduction activities in Lewiston or any place else in the state. And we'll talk about why that's so important. I'm not the clinical person. Ann Seitz will present you kind of the CDC's view of why these programs are so important. I would make just a few opening comments. Syringe service programs are not new. We have over 25 years of history, and we have 10 now providers in the state who have 21 different sites. So this has gone on a long time. It has undoubtedly saved countless lives and prevented a lot of transmission of infectious disease. The syringe part of a syringe service program is just a small part of that program. It's really the referrals, it's the connection that's created to people, giving people a place to connect with people. We know the data nationally is quite clear that an individual who cares enough about their own health and not infecting other people to come in and create a relationship with our syringe program is 5.5 times more likely to get into long sustained recovery than a person that does not make a connection, not make that connection. I think that's just really compelling. Harm reduction itself is just one part of the governor's 6-pillar plan to deal with this issue, which we've been dealing with in her case, in my case, for 6.5 years. Start with prevention. You wish you could put all the resources into prevention, not have our adolescents start down that road. So we put a lot into primary and secondary prevention. Treatment, we absolutely have to have treatment available for people when they need it. We don't have enough treatment, but we've made great strides. Harm reduction is one of the pillars. Recovery support. Once people are in recovery, we need to support them because reoccurrence is part of the disease. So we have recovery residences, we have recovery coaches, we have 21 recovery community centers. I was in Rumford today where we doubled the size of the recovery community center up there. And then public safety. The governor was the district attorney in this district, as you know. She was then attorney general twice. She does not feel that that public safety is anything but on our team. That in Maine, a lot of the most innovative things that have been done to help people in a compassionate way have been done by law enforcement. I think of Robbie Moulton down as the former chief of police, retired chief of police in Scarborough, who started Project Hope. Said, I'm tired of arresting people over and over and over again, and instead we're gonna send them to treatment. So that's our 6th pillar is public safety, and we do try to affect as much as we can the supply side. I work more on the demand side. But again, we have a lot of people. You can't pick up a newspaper or listen to a story. We're seizing drugs and arresting people every day who are bringing these poisons into our state. Finally, this, in my opinion, is all working. I have your fatal overdose numbers in front of me. We don't usually release the fatalities by city, but because you're a large city, we're able to do that. Plus, your own police department has these numbers, and sometimes the police department will put out their own releases. But you have had a decline in mortality of 12% from 22 to 23, 27% from 23 to 24. And if the numbers you had the first 3 months of this month held up, you'd have a 52% decrease from last year. So again, the numbers have improved all across the state. We're down over 40% total from our high of only 2.5 years ago. It's still too many people. But we're making progress, in my opinion. And part of that progress is all of these things, including our harm reduction activities. So with that, I'm so thankful to have a strong team with me today to share data with you, to share information, and answer your questions. And I'm going to turn it over to Ann Seitz from the CDC.
Okay, thank you. So good evening again. So as I said, I'm with the Infectious Disease Prevention Program at Maine CDC. One of our program areas is viral hepatitis and harm reduction. In that program, we have the responsibility of operationalizing the law around...
Can you move the mic just a little closer to you, please?
Of course, yes. Is that better? Okay. So we have the responsibility of operationalizing the state laws and rules around syringe service programs and their certification. So I'm glad to be able to provide you an overview of some of the materials that I was able to provide in hard copy. I come with a letter from Dr. Va, who's sorry she could not be here this evening. In this packet also, you'll see there's some key facts as well as data from SSP programs that are certified by Maine CDC in Sanford, Lewiston, as well as Bangor, to provide a comparison. So thank you for inviting Maine CDC to provide information relative to strategies implemented to address needle waste and evidence to support syringe service programs affecting the city of Lewiston. We acknowledge and take seriously the need to address public concerns around needle waste while simultaneously providing evidence-based services for people who inject drugs. We together are committed to approaching needle waste as an issue that deserves attention, and we really would like to be able to do that together with the City Council here as well as our community partners. We hope that we can address needle waste without or while also maintaining evidence-based life-saving services. So based on scientific research, we believe this ordinance to modify how SSP services are delivered here in Lewiston would be severely detrimental to the persons that are in need of the service here in Lewiston. So it will not address the separate public health concerns of needle waste. So we note that the ordinance proposes many changes. There's a change around the number of needles that can be distributed to a person who comes in to receive services. We've noted that the ordinance also proposes to limit the number of SSPs that can be certified in the city of Lewiston. And then there's also a section of the ordinance that appears to limit the geographic areas where SSPs can operate, as well as other parts of the ordinance. So we believe accessible syringe service programs can be realized while also addressing needle waste, and that these are not mutually exclusive. Restricting access to syringe services have been linked to poor community health outcomes, including infectious disease transmission, so specifically HIV, hepatitis B, hepatitis C, as well as other infectious diseases. Drug-related overdoses, as Gordon has just summarized, as well as other health problems. So I'd like then just bring forward some evidence around SSPs. So we know SSPs, as Gordon had mentioned, there is this opportunity to engage persons in the harm reduction strategies around utilizing clean supplies, as well as involving them in discussion around their addiction and how they may want to access services. And so through that, we can not only reduce the transmission of HIV and hepatitis, but also we can allow for there to be a movement of change and behavior over time that will be effective for individuals to actually move to recovery and be successful in recovery. So in Maine, we have the highest rate of acute hepatitis C in the United States. Also in Maine, we have the second highest rate of hepatitis B. And as you know, we are currently experiencing an outbreak of HIV in Penobscot County, specifically in the Bangor urban area, and all 24 cases in this outbreak have injection drug use as their primary risk factor. So we take this very seriously. We rely on our SSP service providers to be the bridge that helps us engage persons that are injecting drugs to seek prevention, seek opportunities for intervention, and ultimately move them to recovery and back to health. Just to also just touch on that needs-based syringe distribution, which allows participants to receive as many sterile syringes as is needed, is important in several reasons. So a needs-based distribution is an effective strategy to reduce transmission. And having SSPs be accessible without restrictive policies is the best way to serve all participants. Persons coming into Lewiston for SSP services may reside here in the city, they may reside outside the city. They may have a home, they may not have a home. They may be able to seek out those services at the specific times. They may have other limitations in how they can access services. So we are very much in favor of not passing a one-to-one exchange. We feel that limiting frequency of visits can also be detrimental, and we also feel that imposing geographic limits on where SSPs can operate can also be negatively impact the persons in need of these services. So reasons why someone may not have syringes to exchange, why they may not be able to come in and produce one syringe to receive one back. They may have already safely disposed of their syringes. They may have be experiencing homelessness and not carrying those items on them. They may have fear of traveling with their injection equipment. And they may have fear of arrest. In fact, the city of Portland recently that had done some work in this area to look at syringe waste. They conducted community conversations with their clients to understand what are the barriers around syringe waste and proper disposal. And they specifically noted in their report to their city council that it was fear and stigma that really was the limiting factor, even irregardless of having a proper waste disposal mechanism, that they would quickly dispose of that as rather than carrying that and disposing of it properly. And they have taken some measures to try to address that in their, not only in their community, but also support their clients to be able to properly dispose syringes. I just want to also comment that in the idea of limiting the number of SSPs that can operate here in Lewiston or limiting their geographic area would again prohibit this idea of a mobile service. And we have found specifically in Bangor, being able to operate a mobile service where an SSP can operate out of a parking lot of another business or in a space where there's agreement for that property owner, that this has been extremely effective in reaching populations that may be somewhat moving about and not able to access a standing brick and mortar space. So I just want to note that really having flexibility on how services are provided is key. There are many innovative practices in syringe disposal. This is also in your packet. Community events to cleanup events is one. I think there also have been some communities that have been able to engage in contract agreements to conduct syringe cleanups. There is also opportunity of establishing a contact line where an SSP could respond to a customer that has syringes to be disposed. And then one effective measure also that has been thought of in Portland is this idea of promoting the use of a personal sharps container disposal. So all different sizes, a variety of sizes, such that it can fit on their person or be carried easily if they're mobile. And then just to note that the data that is presented here, really what I'd like to just emphasize in the presentation that's part of your packet, that the number of clients served, really what we see here is this is a representation of the demand for services. These are persons in your community, in the larger community, that need syringe services. To further limit, these are people then that go without that service and likely engage in more harmful behaviors. You'll also see that there's data on the number of syringes distributed versus disposed. And what we know is that those numbers are not equal, and that doesn't necessarily mean that those syringes have been disposed of improperly. They could be disposed in household trash, disposed in a public receptacle that is for syringe disposal. And then as Gordon also mentioned, you'll note the number of referrals. And we feel like this is a very critical service that comes with SSPs. I know some of our community partners can speak more specifically about this, but the number of referrals we've seen across the state this past year has really skyrocketed, and that is a pleasing number for us because that means that the service is working. Not only are folks coming in to exchange syringes, but they're asking about other services. They're agreeing to receive that referral to behavioral health or treatment provider or other services that they may be in need of at that time. I think that may be my comments. Maybe just one last point. We are, happy to just kind of give a quick overview of our application process. You're aware many of the areas of the ordinance we're addressing kind of a standardization of how syringe service providers are certified, and that entire process is led by the state. So we have an existing process for syringe service providers to demonstrate their capacity to operate according to the state regulations around SSPs. So they prepare an application, they have to demonstrate proof of different policies around privacy and handling, all different aspects of their operation. We are also collect monthly data from SSPs on their activities, and we conduct a quality review of those data to be ensured that those activities are happening as intended. And then I mentioned the high number of referrals, and I think that kind of speaks to the overall need for SSP services across the state. In fact, there are many areas of the state that do not have an SSP, and further limiting SSPs, particularly in urban areas where there is a demand among that population, but also a larger demand for that service, I think can have a profound impact across the state. Be happy to answer any questions. Thank you.
Good evening. Catherine Ryder. Before I share the background of the first harm reduction program here in the city of Lewiston, I'm just going to say that Spurwink endorses everything my colleagues have said, and I'm not going to repeat it, so I'm going to share new information with you. In 2018, when I was still acting as CEO for Tri-County Mental Health Services, we were blessed to receive a 3-year grant from the Maine Health Access Foundation to address the opioid crisis in our community. And we chose at that time to look at building a recovery-ready community and everything that that meant. And what we understood would be essential was that key organizations of this community would come together collaboratively, at least on a monthly basis, as part of a steering committee to start talking about no wrong door. So that when people turned up, wherever it happened to be, whether it was in the community, on the streets, whether it was with law enforcement, with EMS, at our agencies, that we would be ready and we would work collaboratively together to address that issue. So we broke into a steering committee of key leaders from our 2 hospital systems, from law enforcement that included the Sheriff's Office, Lewiston, and Auburn PD, our community behavioral health providers, critically important people with lived experience with recovery, and some who were still in active use so that they could share their stories and help inform us as we moved through the process. And then other community providers, like some of the shelter folks and other resources like food kitchens. And we met for 3 consecutive years in well-established committees. So the steering committee was the overarching committee, and then there were 5 subcommittees that included law enforcement, people in recovery and living with active use, providers of clinical services, and other organizations across the community. And those breakout committees would meet also once a month. So it was a fairly significant commitment, and we weren't sure people would follow through. They did. In 2019, we started to talk about what it would take to have a syringe exchange / harm reduction program at our organization. And you've heard what Ann just shared about what is expected from the CDC when you do that. So it was no small lift. And we put another committee together to write policies and procedure to make sure we had a training program so that staff would understand expectations. And it took us, I would say, upwards of a year. By the time we got into 2020, which is when we opened our syringe exchange program, it was COVID. And so we were not able to have folks come into the organization, so we established a lockbox outside of the agency with a unique code that folks could drive up, and everything was prepared because there is documentation that needs to be completed for each exchange. And we would assist with facilitating the process. And then as COVID titrated back down again, we were able to start seeing people, bringing them in or going out. And I would say to you, when we took this on, we understood that it was both a privilege that we were able to serve people and help them find their road to recovery if indeed they were interested in doing so, and also a responsibility to our community to ensure that we address the issue of waste and that we were able to provide for that, and also a responsibility in working with our clients. And if you had the opportunity to read my testimony, which is included in your packets, you will see that I have shared that each and every exchange is an opportunity to plant a seed of hope and a potential recovery journey. And Ernestine, who will talk to you in just a moment, my colleague from Spur Wing who oversees those programs today, will tell you that it can be the same day, it could be weeks or months, and sometimes years before someone says, today is my day. But when it happens, we celebrate that. And so we also believe that we have a responsibility to educate the people that we work with, again, to the fact that this is a privilege that the community has provided us with, and it can be swiped away very quickly if we are not wise in how we do the work that we do. And so all of that is a part of how we operate our program. And I would just share with you that I have been blessed to witness recovery journeys of many, many individuals. During that grant period, we also established programs that you may be familiar with, Project Support You. And that started with about 10 hours a week many years ago. And we now have, how many providers? And Ernestine will tell you more about this. 7 full-time providers that are working in our community, traveling alongside law enforcement, EMS, fire and rescue. So those people are making a difference. Some of them are walking the beat, if you will, with law enforcement. They are in our community parks, so they are able to provide hope and resources, make connections, and we know that on average we are able to connect folks when they say they're ready in 1 to 3 days, most often 1 day. That is a phenomenal outcome. And so I will stop there, and I will let Ernestine talk more about the day-to-day activities that she has been overseeing, and I too remain available for questions.
Thank you. Good evening. I have the pleasure of overseeing a variety of grants that are all community outreach based, and they represent the team. And predominantly out of the 15-member team, there are 12 that serve Lewiston very specifically in a different fashion. And there are 3 that represent the harm reduction clinic based at 1155 Lisbon Street. I've been with the organization for about 3 years, and when we began, we had myself and one individual that worked 14 hours a week doing harm reduction. And it predominantly, like Catherine had mentioned earlier, predominantly was putting supplies and retrieving supplies from the outside box, the after hours box. And that was really a lot of the engagement that we had. And so we had to get creative about how to get people in the door. And when last July we were afforded more grant opportunity from the Maine CDC and the state to then open up a clinic full-time. And there began the journey of figuring out what would be the best formula for bringing people in the door, because we knew we could do more effective work if we could just have engagement with people and make that connection. And so we hired 3 individuals and 3 full-time individuals, and all of them are recovery coach certified, and one of them happens to also be a harm reduction specialist. So within the clinic, we are open 40 hours a week, Monday through Friday, 9 to 5. And we also have the after hours box, which is any day of the week. We can put supplies in there and whatnot as well. So I wanted to talk a little bit about what kind of services that we offer out of this clinic as well. And it's kind of a robust list. I surprised myself when I wrote down exactly what we're doing there. So probably the first thing that I usually discuss is recovery coaching. That is the essence of the work that we do, is really about engagement, connection, and also the 3 individuals that work in the harm reduction clinic are all, they will introduce themselves to anyone with their first name, and then they will say, I'm a person in long-term recovery. And they do that introduction to every client that also comes into the clinic. So they know exactly right from the moment that they step into the clinic as to that they have someone there that understands recovery and understands the struggle also to get there. So recovery coaching, we also, because of our harm reduction specialist, then she is certified in providing Hep C and HIV rapid testing, which we are able to do right there on site for any of our clientele. We offer safe sex supplies for males and females. We have first aid supplies, wound care supplies, naloxone. We offer training for Narcan as well. We offer hygiene supplies, nutritional supplies, referrals to treatment, including mental health, substance use, medical, dental, etc., connections to area resources regarding self-help meetings, food banks, transportation, etc. We also have we are a pilot site for with the Brain Injury Association for New England, and offer overdose screenings for potential brain injury, because it is known to be that at least half of all substance users are at risk, or they have suffered a brain injury because of overdose. So we do those screenings there at that clinic as well. And we offer a syringe exchange. The reason why I list that last is it is a very small portion, actually, of what we do there. All of those other things are really what engages people and gets them in the door. And then also at the, sometimes people are coming in and asking and receiving all of these other services, and they're not receiving syringes at all. They're there for the recovery coaching. They're there for the testing. They're there for supplies that have nothing to do with syringes. And then, of course, we do have people that are coming in and bringing in syringes and also receiving them. So it is a very small, the reason why I list that last is because it really is the smallest portion of our clinic. And it's not always the way that we engage with people. It's not always the way that people start with us either. I brought in supplies because I thought it would be really important for you to know that every single person that comes in, whether they're new or they've been there 5 times, they have a Help to Hope bag that they are given. And I will demonstrate for you exactly what's in this bag. So there are Narcan for each person. There's also instructions on how to use it. There are overdose prevention information and pamphlets on how to reach out to people in regards to that. There's xylazine testing for their substances, as well as information about xylazine, which we know is obviously plaguing our system currently. There's HIV and Hep C information, resources, connections, how to get testing. We have what they call a TLC bag, always dry socks, which are very instrumental to sometimes just, feeling a little bit better about yourself today, is a fresh pair of socks. There's usually some applesauce or, some sort of, there's a granola bar, juice boxes and whatnot as well. We have hygiene kits, which are a host of things. There's masks in there, toothbrush, toothpaste, shampoo, conditioner, hand sanitizer, combs, tissues, chapsticks, a variety of different things. First aid supplies, so these are generic first aid supplies that gives them a little bit of everything to be able to help with basic wound care. And then we have a little bit more comprehensive wound care because of the xylazine that is hitting the supply out there. Then there are a lot of wounds that require specialty kind of dressing, as well as ointments and Medi-Honey. There's a variety of different things, Coban, a lot of different products that are very specific for treating those kinds of wounds. You can't just put a Band-Aid on it and call it good. So we want to make sure that they have what they need in order to take care of themselves. Let's see. This is a resource packet, which has all kinds of area information, rack cards, phone numbers, hotlines, you name it. It's this grows all the time because we learn of a new service that they might be helpful to them, and so we continue to add them in there, and lots of contact information as well. There's a fentanyl test strip and kit as well, and as well as information about fentanyl particularly. There was a time we were giving out lots of these. This is a COVID home test, but we still give them out anyhow. Most of you are probably familiar with Journey Magazine. This is an important collaboration that we have with Journey Magazine to also promote recovery and hope and whatnot. We have a lending library, which is always resources and books that are particularly that are supporting of persons in recovery. So it's when we first started that, people were concerned that people would steal the books. I said, I would rather have someone steal these kinds of books and not return them. I don't have a problem with that. So, and they do. They fly off the shelf and they don't always come back, but that's okay. So that's a good problem to have. We have 5 different selections of sharps containers that we offer. So we have ones that are as tall as this table. We have one that is about half of that size. And then then this is one. They all have tops, but so you can see there's a variety of different options that we give them. We have these all displayed in our clinic so they can just pick. They can take 1, they can take 5, whichever that they'd like. I didn't plan for this to not open for me, so apologize. Okay. There we go. There's more of a personal size as well. And then we also give them instructions for if all of these go away and you need to dispose, then there's a whole pamphlet, 2-sided pamphlet about how to do that, what to put them in, how to properly dispose of their syringes. And then also this is a really cool little tool that we also give people, which is called the BD Safe Clip. And what this does is actually, it's a really amazing device that is, you can put the used needle, the needle part in here, and you just press click, and it actually holds 1,500 needle heads in here. So what's left is just basically the plastic. So there's no harm to anyone if they happen to find that. So sorry to crowd your table, but I thought maybe this would be very important for you to know that it isn't just about people walking in, here's my syringes, and they walk out with those. There's so much more that's happened here. This is really just a small portion of honestly what they walk out with. Sometimes they're holding 2 shopping bags, full of things, and they're coming back several times a week. I'd like to kind of tell just a miniature kind of version of a story that I have worked with primarily with this individual for almost 2 years in the exchange. And it's a young lady who, our only engagement at the very beginning was that she was calling and saying, this is what I need for supplies. And she'd say, I'm going to be coming on a Saturday morning at 3 a.m., leave them in the box, and that's it. She would not stay on the phone very long. And, that was our level of engagement. And that continued for quite some time. And eventually, I was able to get her to come inside to our building at 1155, but she would not come in past the waiting room. And she felt as though that, there was stigma that was pretty significant, even though she was pretty camouflaged with what she was bringing in. Nobody was really aware of what she was doing, why she was there to see me. But that's how she proceeded for quite some time, was to engage with me doing that just in the waiting room. You flash forward a few more weeks, even into months, and her engagement and her trust in me, as well as what we were doing and what we were trying to accomplish, and making a connection with her and providing her some hope, eventually led to her to come down the corridor to the clinic and sit down and talk with my staff, talk with myself, and eventually she was, after it probably took almost 9 months for her to actually fully engage in all of the services that we're able to provide there at the clinic, and for her to engage them so much so that she took a referral one day and went into long-term treatment. She is about 157 days clean and sober today. I just saw her yesterday, as a matter of fact. It's close to my heart because I get to witness someone who had no hope in herself or her future, or even people when she first began. And now she is someone who's giving back to the community because she also takes additional supplies and tries to educate others and tries to support her peers who are still struggling out there. And she tries to engage, and she's brought in many people to say that you can trust them, and this is what they do for you here. And
I understand we need to
yes,
finish up just so I get to
absolutely.
But thank you.
The last thing that I want to leave you with is a message that did come from her, but also kind of sums up the whole point of our clinic and really the heart of what we do. And she said to me today, she said to me a while ago, she said, I know what you've been doing all along. And I said, what's that? And she said, you've been holding hope for me until I found it for myself. So I leave you with that.
Thank you. Anne's going to stay with me, Director Sites, and then Catherine and Ernestine will give up their seats. And I want to bring up Zoe Brocus from COSI. I know Zoe's out there somewhere. Yes. And Dr. Paul Vinsel. And we'll just have a couple minutes, maybe 3-5 minutes from each, so that we have some time for questions. Thank you. Ernestine. Dr. Vinsel's a physician who provides care at the jail too, does some Suboxone there, and he can introduce himself, but he's an extraordinary individual. I want you to know that. And Zoe is too. Where's Zoe? Oh, there she is. Zoe, it's time to come up and join us at the table, Zoe. But Paul, why don't you start and say a few things?
Hi, thank you, Mayor Shaleen and members of the council. I appreciate the opportunity to talk. I don't have any prepared statement because I didn't know I'd be talking until I came in the room. I really can't add too much to what Ernestine said. I thought her presentation was wonderful. But I'd like to give you a couple of stories. So I'm a addiction medicine physician. Previously, I was an emergency physician. Right now, when I see a patient who comes into me for the first time and they're interested in going into recovery.
Can you just move the mic a little closer to you, please?
I'm sorry.
Thank you.
Right now, when I see a patient for the first time, they're interested in coming into recovery and into treatment. If they tell me that they've been going to a syringe service program, I know immediately that they are interested in their health. They're interested in helping themselves, the community, and I know that our chances of a successful recovery are much higher. I'd like to give you 2 examples just that have occurred to me in the last 2 days of people that are going into treatment from a syringe service program. Yesterday, I received an email from one of our syringe service specialists at Spurwink asking if I had room on my schedule for 2 new clients. They happen to be a couple. They are homeless, they have opiate addiction, and they've been using the syringe service program. Neither of them have a telephone. The syringe service specialist is going to be my go-between to getting them scheduled. I gave her the time and dates that I have openings. She's bringing them to them and let them know, and she's going to come back to me with when they're available to come in. And she will bring them in. And I won't see them, I won't talk to them until they come in the office because I don't have any opportunity. They don't have a phone. If we didn't have this syringe service program, they would never have gone into treatment. Today, through Spurwink, I'm contracted to provide services at the Androscoggin County Jail for patients with opiate addiction. Today I saw a patient for the first time. It's his intake. And I mentioned that I'm employed by Spurwink, and Spurwink contracts with me to do this work. He says, I know Spurwink because I use their syringe service program. I think those are just 2 huge examples of how the syringe service program is helpful for getting patients into recovery.
Zoe, go ahead. I'm going to have you do about 7 minutes.
Yeah,
And then, because then that gives them at least 10 minutes to questions.
Sure.
And thank you for being here.
Thank you. Hi, everyone. I'm Zoe Brokus, Director of the Church of Safe Injection on Main Street. And we have been in operation since February of 2022. And we see primarily a population of people who are unhoused and managing, I think, what we would consider a fairly chaotic relationship with the substances that they're using. So our day-to-day objectives are building a foundation of trust with a population of people who oftentimes don't have anywhere else to go, where they can talk openly and safely about what they're experiencing and the type of healthcare that they really need. And so we do a ton of referrals. We were looking at our numbers today, and it's about 6 referrals per participant annually. And those are usually referrals for other healthcare services, primary care, mental health services, treatment and recovery resources, housing, all the things that have been named. But it's really about building that safe place where people can come in, because sometimes it does take 2, 3, 10 times talking to somebody about what some options might be for them before they're kind of ready to take that next step. And so in the meantime, it's our responsibility to help keep them as safe and healthy as they are able to be, while recognizing that that is part of the larger safety of our whole community. And so we look at any collaboration, with the city, with community partners. We work really closely with Maine Family Planning, for example. Those are always something that we're willing to do, recognizing that we also have limited capacity as a small organization, really barely touching the great need that there is for the community of people that we serve. So we're happy to be part of any solution, and it's really inspiring hearing Spurwink's numbers, and working together as harm reduction organizations is something that I think we're also deeply committed to continuing to do.
Thank you, Zoe. It's your turn. Any of us are able to answer the questions. You can direct it to us generally or to a single person. And thanks for your time and being so patient with us.
Thank you, all of them. Thank you, all of you. And as the counselors begin to think of questions, I just have 2 really quick ones. So right now, someone can come in and get 100 needles. Is that correct? And then can we speak to the reasoning behind that number?
Well, I think either Ann or I could do that, but I know I have the history. It's not because our statutes changed a few times. So for years we lived with a 1-to-1 exchange, and then it was expanded.
If you can move the mic just a
but
little.
It's not expanded to a needs-based exchange. The 100 limit was a compromise between those interests that felt that you just give a person as many syringes as they believe that they need, to people who would have stayed with a 1-to-1. So 100 was a compromise. I think it's really important to understand that each program makes its own decision, sometimes based upon supply. So Wabanaki, for instance, a fairly new provider in Bangor, they do 50. There is another place opening that's going to do a 1-to-1. Sanford now does 1-to-1 because of an ordinance. Others do 100, but they don't always have 100 available. So, but that is the regulatory structure. I think it's also important to know that the CDC has the regulatory authority and not only gets all these monthly reports and puts them into an annual report that you now have, but they also do inspections. And they did shut down a program last year in the city of Bangor based upon what they felt was primarily a lack of staffing. I'm not saying that's the sole issue, but I want you to know that they take this very seriously, that there's a whole structure here of regulation, and we frankly, we prefer that the municipalities work with us and work with our regulations and not put another level of regulation on top of what we're doing. Thanks. Yeah, do you want to address what I said?
Just to comment that a person can come into a syringe exchange and receive up to 100 syringes. So the one-to-one is not to say if I bring one, I can get 100, and I bring another, I can get another 100. No, it's up to 100 at each encounter.
Yeah, and I was just going to clarify to say, typically, each encounter involves a conversation too. So it's not just handing out 100 syringes. It really is checking in on the individual level to see what the person's need is. And oftentimes it's a much smaller number of syringes. For the people that we see on a day-to-day basis, it's usually 10 or 20. So it's not like this number that just is automatically going out. We are always encouraging a one-for-one anyway, because it is really best to ensure the syringes coming back in. However, in a city like Lewiston, where we have community sharps disposal boxes in the community that we want people to use, we want there to be an incentive there as well, so that people don't feel like they have to hold on to their used syringes to bring them in.
Thank you. Councilor Harriman.
Thank you. Thank you all for being here and for your presentation. So my question is about syringe litter. It seems like that's been the main reason for this conversation coming about, and I was a little disappointed that the ordinance doesn't seem to address litter at all. So I'm wondering, first, what have you found to work as far as programs or incentives or anything else that can reduce syringe litter? And I'm hoping that we can do something about that, because that is a real problem. I just don't see anything in this ordinance that will address that.
Well, we agree that the ordinance doesn't address it. We agree that it's a problem. And the material that the CDC has prepared for you also has a number of approaches to it. I've worked with Bangor, I've worked with Portland. Portland did a fairly innovative thing 6 months ago and has a program where people that are enrollees of the syringe exchange receive a small amount of compensation for bringing back a needle. I think it's 10 cents. And there's a cap on that. They can get like $20 a week. But they've gone from like 63%, return to like 97%. They think it's been quite successful for a total of like $14,000, and they used opioid settlement funds that the city has to do that. I just throw that out as one innovative thing. Bangor has contracted with organizations to do a pickup. At the same time, we would encourage our programs here in Lewiston to do a regular pickup themselves, do a pickup day. They've had some offers from their colleagues around the state to come to Lewiston and have a significant event this month, because we know it is an issue. And we know how much it hurts our efforts when a family feels that they can't take their kids to Kennedy Park because they're going to find needles or on a trail. We have worked on this issue all over the state. There's a whole means of ways to do it. And to us, that's a different issue, honestly, than our harm reduction and preventing the transmission of infectious disease. Two different things. We've got quite a few solutions over here. Over here, it's much more complicated, but we need to do both, and we want to work with the city to do both.
Councilor Gallant.
Thank you, Mayor. I do have a lot of familiarity with what's going on out here. I know Catherine very well, worked with her before, worked with people in addiction. I guess my question is, you talked about Bangor and the one you had to close down due to manpower. What about documentation? We requested documentation for months on certain entities in Lewiston, and we never received it from the CDC, quite frankly, and because I don't believe they had it. And at what point does that become an error enough for you guys to look into it to do something? Or is it a blind eye because you think the reduction is more important? And I believe the reduction is extremely important and how it works. But I also believe 20 years in the military that, no job's too big, no job's too small, no paperwork, no job at all. So I think that if you're not tracking it and they're not doing their part, at what point does somebody step in to fix that? And that's a concern that I have as a counselor. The litter, I think, is something we're going to have to try to figure out, and having some kind of pickup from the people in the community. I guess I would ask, is there money through the state other than opioid funds to provide training? Because, again, I've been out with pickups, proper gloves, proper ways to take care of it. I've been involved with 2 or 3 different ways. We had little clip things you picked up with them, you dropped them in big buckets, and you brought them to somebody. I mean, there's many ways it can be done. In that process. But my biggest concern is documentation. I just don't like to see or know that we can't get copies of things that are supposed to be provided to the state on a timely manner, and that just is a big red flag for me.
Thank you. I really appreciate that question, and I want to just acknowledge that if that occurred, if there was a request that was not answered, I'm very sorry about that, and I'd be more than happy to follow up directly with what materials you're requesting. As part of the contracts that each of the certified SSPs have with Maine CDC, there's a requirement to report monthly on specific data points, including those that are within the file that you've received. The payment of invoice relies on that submission of report. It's due within 15 days of the end of the month, and we follow up to obtain that report if it's not submitted on time. Sometimes there are extenuating circumstances, but generally that is the route that it takes. So we do track this routinely, and then at the end of the year, at the end of, I believe it's November, we roll up all those data, and that's what the data that then we have to report back to the legislature regarding SSP activities. So that is the report that you have in front of you now, or is available to you now.
I want to address, Council, you mentioned the money. It's very timely because tomorrow in the legislature, they should have final enactment of LD 1738, which sets up a pilot, a program where there would be incentives for municipalities to deal with syringe waste. Now, it's the legislature. I can't tell you what's going to, but we've thought a lot about this, whether it's settlement money, whether it's state money. In the grand scheme of what we're spending on opioids, this is a small amount of money, and so we're working on it.
Great, and I both great answers, but one quick follow-up, if I may.
Sure.
I know that if it's a voting time and we hire these voting people to go out and get signatures, and they get so much a signature, there's nobody really proving that the people were there, or that they're even real in most cases sometimes. So I have a concern that if I can get paid by writing Joe Smecatelli down, because don't give you his name or her name, or I give them a couple initials, that it could be falsified quite easily based on the system and what's in place. Is there any checks for that?
So part of our responsibility to the state of Maine is to ensure that SSPs are operating according to the rules and regulations. And so we have done visits to SSPs, announced or unannounced, where we can check and look at how they're maintaining their operations, including their data. Yes, that would be a gross violation of the rules and regulations to falsify records for the purpose of, demonstrating that they delivered service, for sure. And yes, there are circumstances we've done this. We do take this seriously. When we receive a complaint, we log that complaint. So any complaint that does come into our office, we do log, and there is an action that we take on behalf when that complaint is received.
Good. Thank you very much for your answers. Thanks for being here too, please.
Councilor Najin.
Thank you very much, Mr. Mayor. Thank you all for coming here today. Greatly appreciate the testimony. One piece I would just mention right now is a lot of the information that we went over has nothing to do with any of the ordinances that we have in front of us. And so you don't have to sell me on what SSPs do in our community. I'm well aware. And I greatly appreciate the efforts in order to reduce harm in our community. What I would say, though, that several times during this conversation there was a indication that there was a responsibility to the state. And so when we look at the pillars of dealing with our current SUD crisis. It was prevention, treatment, harm reduction, recovery and support, and public safety. Nowhere in there was there community health or responsibility to the community that we exist in. And so the issues that I have are that we do have the right to regulate businesses within our community. We have the right to determine through zoning and in order to support complementary and accessory uses and to discourage incongruous uses, and that's primarily to manage conflicts and to protect people, including, for instance, in the cases of folks who, people who use drugs, making sure that they are not further stigmatized, making sure that their needs are not abutted to residents, businesses. These are all pieces that we need to manage together. And one of the pieces, when we look at a holistic approach to dealing with public health crisis, creating a secondary public health crisis is hard for me. Ultimately, where is the funding for the municipality to deal with needles? I'm not against the idea of having a needle exchange that permits, an SSP that permits, even an unlimited amount of needles. I think when we see needles in the community, we're aware of the fact that they're being used, and so therefore that they're serving their purpose as far as reducing harm with bloodborne diseases in these pieces. But how do we reduce the harm to our community overall? And that's the challenge that I do not think should fall on the municipality alone. There are, I believe, 2 licensed needle exchanges within Androscoggin County, and they're both located within Lewiston. We know that there are people coming into our community who are seeking drugs. Obviously, we're a source of drugs, and so in that space, reducing the conflicts is what I'm talking about. These are the parts that we need to address, and we haven't addressed them in any of the conversation that we've had. That's the challenge that I have, is that I have residents, building owners, businesses that are concerned, and also have compassion and empathy for the people who are experiencing these challenges. And so when we talk about these pieces that are in place, like what are the best practices, what are the good neighbor policies, how are those enforced by the CDC for SSPs? Like what is the requirement to run a SSP that has complaints from the community? Like what is the requirement to follow up? Because I believe that we can land in a place where we have SSPs that operate in our community, reduce stigma for people who use drugs, have equitable access to our public spaces, and reduce the challenges around some of our public safety issues. And that's where I want to land. So, I just want to bring all that forward as food for thought. I know that it's been a long meeting already, and so we probably don't have all the answers immediately, but again, the challenge is how we manage all of the needs in the community while holding our community health, including the people that use drugs in our community, because one of the huge factors with people who use drugs is avoidance and loss of access to community. And so, I think it's important that we land in a place where we can all be happy, and that's why I bring all this up.
Oh, it's about balance. I agree, and we want to work with you on that. You're absolutely right, and I certainly didn't want to imply in any way. You have every right to enact a municipal ordinance. The legislature has not seen to override the interests of the municipalities in saying you have to do this. So you have every right. We'd like to work with you on an ordinance that. We've told you the 2 things that we think are perhaps most damaging from a harm reduction standpoint, but we want to work with you. If you decide to move ahead with an ordinance, we'd like to work with you on it, and we absolutely agree that all the interests need to be represented, the business interests, the parents' interests. I don't disagree with anything you've said, really.
Can I just add that I think in Portland, about 15 years ago, we started the first community sharps disposal program, and it started with a small task force of individuals. And to me, I think that seems like the next step is really getting a small group of people, including both of the SSPs here in Lewiston, business owners, whoever makes sense, to really start talking about the best way to address improperly discarded syringes, because there's solutions that are fairly simple, and I think it just is going to take a small group of people to focus some attention on that. And then also commitment from the SSPs. We did a cleanup day today. I think both of the organizations are committed to doing that monthly, or we'll sort of figure out what the best timeline is. But I think a task force, a dedicated group of people to really look at the various aspects of this issue, I think could be fairly straightforward and produce good results.
Councilor Longchamps, did you have a question?
Basically said everything I wanted to, so
Okay.
nice job.
Yes, Councilor Chittum.
Thank you, Mr. Mayor. Thank you for all being here tonight. Excellent information. I appreciate the perspectives of harm reduction, which are of paramount importance to me. I appreciate Councilor Harriman's comment that this whole this snowball started rolling downhill. It was fairly small because it pertained to needle litter. However, it has grown to encompass much more than that. Notably, needle litter and the behavior of some of the clients of the exchange providers. Those are the two things that I think bother the community, the businesses, the public the most. If we can address the behavior, the misbehavior of clients who, well, we've seen what happens outside some of the exchanges, and address the needle litter. I'm not certain that our ordinance does that. I appreciate the criticisms of the ordinance. I share some of your concerns about that ordinance as well. That I'm going to say draft ordinance. It's not an ordinance yet. We have a long process to go through. And I welcome the assistance of anybody who wants to contribute to drafting an ordinance that not only does not mitigate harm reduction, but also addresses the problem of misbehavior in public and needle litter. So again, thank you for being here tonight. I do have one question for the providers. As the ordinance is drafted today, and I'm sure you've seen that, and I don't need an answer now, but I would like to have, how does that affect your operation? As that ordinance is drafted today, how would that affect your operation, and what are your perspectives on its effect on the mission that the providers have? Thank you.
Yes, Councilor Sol.
Hi, thank you for being here. So I have a few questions. My first question is, so prior to COVID, we didn't really have all of these issues that we're having right now. So my question is, is it because of the ratio change? Because when it was 1-to-1, we didn't seem to have so much litter. So I'm just curious if you have any suggestions for that.
Yeah. I'm not able to answer that question. I can ask my colleagues and try to get back to you to see what might be the difference. And
has there been an increase in clients?
Oh, for sure, yes. I mean, if we were to just look from, yes, and I do think there are some
Speak
data.
into the mic, please.
I do think there are some data in your packet relative to annual rates, and so you would be able to
It's
see
more for the
some
public
increase.
so that they can hear the answers as well. So this may be a hard question to answer. But
I'm sorry, 1 second, Councilor Sol. Can you please finish what you were saying?
No, I think I did complete my thought, that there are data in your packet. I think it shows over time, and so you can see just in terms of, the visits as well as the exchanges, syringes distributed as well as dispersed.
Yeah. So I guess on average, how many syringes would one individual use in a day?
Again, I'm not able to answer that question. Maybe an SSP could, but I believe it's really dependent on their use, and where they're at in their use. And yeah, I think it can really vary.
Yeah, it can. It varies person to person, substance to substance, and it can change really depending.
Please move the mic closer to you.
Really depending on, just how, there's a variety of factors, but, that's one of the reasons why not having a limit on the number of syringes feels really important. And, being able to work with the individual and being flexible. We'll see people who just got out of jail or who are new to the community or, had their backpack stolen, different situations. And we want to ensure that every individual we see does not need to reuse a syringe, which can cause significant harm to their bodies. I'm sure doctors could talk about it better than me, or share syringes, because we have, a big concern about, there's new cases of HIV in Bangor, and that's not far from Lewiston. People travel all the time, and so really ensuring that people have the supplies they need to be as healthy as possible is important.
Were those individuals that have been identified with HIV, were they using the program?
Well, I don't know if we know that. I would.
Do you mean the individuals identified in Penobscot County? I don't know actually, but I do know that they all reported having used injection drug in the past year prior to infection. And many in our investigations, we also ask questions about whether they have shared syringe supplies, whether they have contact with others through sex, and so these are all part of the risk factor information we do collect. IDU is the common risk factor for all 24 cases.
Okay.
And homelessness in almost 22 or 23 of them. Paul, did you want to add?
Yeah, Councilor Sol, thank you very much for that question. And I'd like to address two of them. One is my feeling that a lot of the increased needle waste is due to the increased amount of homelessness we have, so that people are living in the park. That's their receptacle. If they were at home, they may keep it in their kitchen, they may keep it in their bathroom, they may put it in their wastebasket. The second thing is, you asked how many syringes someone might use in a day, and that's a fantastic question. One of the problems right now with our drug supply is fentanyl. When it replaced heroin would last 3, 4, 5, 6 hours. So someone would maybe use a couple times a day. Fentanyl lasts about an hour. So someone who uses, if they don't use within a couple of hours after, they're going to start having some withdrawal symptoms. The gentleman I saw today at Androscoggin County Jail told me that he was using up to 20 times a day. Wow. Which kind of shocked me. That's the first time I've heard that number. I usually hear 5, 6, 10, but he said 20.
And Paul, you might also, or Zoe or even Ann might address that it's not just about sharing syringes with another individual, but each time a person injects or tries to inject, they need to use a unused needle. You could explain why that is, Paul.
The needles become dull pretty quickly. After the first injection, the needle is much more dull. And the next time if they use that needle again, it's going to cause more damage to the skin, more damage to the vein, and put them at more risk for skin infections, because the skin is your first defense of infection. So if they reuse their own needles, it puts them at higher risk for localized infections.
Okay, thank you. I have one more question. And again, it may be hard to answer. The recovery rate or attempted recovery, because I know that can happen multiple times, through the program, do you know what that rate is?
The short answer is no. And the reason, of course, is that, there's anonymity associated with the program itself. We know how many referrals they've made to treatment. And we also know that recurrence is a part of the illness. So it honestly, I work every day, this is my life, for 6.5 years to look at all that data every day. How many people are using drugs? How many people are trying to get into treatment, can't get in? How many are getting into treatment? How long are they staying in treatment? How much recidivism is there? It's impossible to know.
Well, thank you all for being here and answering my questions. I just want to end it with, I do support harm reduction. Oh, one more question. Sorry. Harm reduction program, and I keep hearing, that overdoses are down.
Mm-hmm.
How does a harm reduction program prevent overdoses?
Well, I think in a number of ways, but one of the ways is is the referrals of people into treatment. And it also, when they come into an exchange, they can get Narcan and many other things, as Ernestine so vividly showed us today.
Yeah.
So, I mean, and connecting people. I'm not a person in recovery, so I've had to listen very carefully to people. And every day I get an opportunity. I was, as I say, in Rumford today, and it's all about connection. If we could just lower the stigma, just love everyone, realize that they're just people. I had a reporter ask me one time, well, why would we care about these people who use drugs? I said, because they're people. They're somebody's son, daughter, brother, sister, parent. I had 2 80-year-olds fatally overdosed last fall, somebody's grandparents, okay? So again, it's connecting people to the community. The talk we had about balancing these interests, incredibly important, because these are also your citizens, your family members. So that's what it's about. It's not the only thing. We've also they could walk into a syringe program, or they could walk into a community recovery center. They could walk into one of Deb York's places, God bless her. But there's 21 places that people can go and get help, and much more likely to eventually get on the right path.
I think a lot of the frustration from the public is, and yeah, we have empathy. We really do care about everybody in the city.
I know.
But you have this group of individuals that are creating all of the litter, the behaviors that are coming with it. It's scaring our residents. And with almost 40,000 people in the city, they're the ones who are paying the price for everything that's happening. So that's what we need to try to figure out, how to stop that, because it's just not fair. It's not fair that the citizens have to put up with it, that they have to support it. But I know it's needed. So I don't know what the answers are, but this isn't working. Thank you for being here.
Councillor Stoll, you asked percentage-wise, and I can't give you the percentage-wise of the syringe service programs, but I asked our vice president of the patients that I have seen, how many of them are still in treatment. Spurwink took over Tri-County, and I was with Tri-County first, but they took over April 1 of 2024. Of the patients that I have seen or have started seeing after April 1, 2024, 93% are still in treatment, and 0 of them are using substances at this time.
That's fantastic to hear. Thank you.
Councillor Roy.
Thank you, Mr. Mayor. Thank you all for being here today. It's really an eye-opener. The education in the room is really great. I think there are a lot of great programs out there. Harm reduction is near and dear to my heart. I really love that. I've heard a lot about trainings, a lot of trainings and all this stuff. Is there any way that we could get a safe disposal training? Like, I know we have pamphlets and stuff like that, right? So again, putting that out there, every time somebody gets that in a pamphlet, is another chance to make a good neighbor, right? And we all talk about being good neighbors. We've had a lot of great ideas from the council here, a lot of great points being made. I had a lot of questions that I had for you, but they've all pretty much been answered and addressed. But the other thing that I really wanted to say is there a sharps box that could be a lot harder to get into with only one needle to go in and none to be able to pull out? Because again, if we can give a personal sharps box to people that can only put a needle in and not take out, that's going to solve a little bit of the problems too, right? And I also don't know if we could make a task force on maybe the providers and the city working together to come up with ideas to really address this issue with a lot of the professionals in this room. So that's what I want to say. And I really think the PSY workers, great. I really, really love that. That's been a real game changer for a lot of people. But I really wanted to thank you for coming out tonight. So.
Speaking of PSY workers, here's to you, Dave Bilodeau. Thanks for everything. Yes, Councillor Najin.
I have a series of questions I'm going to want to email out because we are going over whether or not we're going to adopt the Needle Exchange Program ordinance as written or modified. So I have specific questions that I would like some feedback and clarity on. Clearly, we're not the public health professionals, and we don't want to become the public health professionals. But I think, striking a balance between, there isn't anybody, I think, in this community that doesn't know somebody who's been affected by SUD. It's a tragedy at this point in time that we have not devoted more resources to dealing with these issues. And so, you have my support in the work that you're doing, but we need to find that balance, I think. And if you can provide me with the information I'm looking for, very possibly it could help to guide some of the conversations that we're going to have. Thank you so much.
Councillor Roy.
Thank you again. Sorry, in all that excitement, I forgot to bring something out. So one of the big things for me is this. We have a small population that are using the needles, right? We have a larger population that are being affected by it. If the state were to give money, because again, there's a lot of businesses out there that it shouldn't fall on them to clean this up. There's a lot of citizens out there, it shouldn't fall on them to clean this up, right? So we need all we can get to maybe, I don't know about hiring workers, but we need trained people to get out there. And I mean, again, it shouldn't come from the municipalities. I mean, the state really needs to address this, I think. And if we could partner with that, because I think that's the biggest thing right now is, we shouldn't have taxpayer money to do this.
Councillor Harriman.
Thank you. That reminded me of another question I had. So when the CDC reimburses SSPs for their expenses, is cleanup of syringe litter one of those? And if not, would this LD that Mr. Smith mentioned, would that help provide the funding to do that?
Currently, syringe service providers are not required to perform community cleanup activities, so it's not part of the current contract obligations. The LD, is it 1738? LD 1738 would be administered by Maine CDC and could be integrated not only for potentially SSPs, but community municipalities, other partners to receive a grant and then perform community activities that would reduce syringe waste.
Okay, thank you.
Any final questions from councillors? Yes, Councillor Najin.
I just have a quick question. Is there any program that is run in the state, either in conjunction with SSPs or by SSPs, where there is intervention concerning public engagement for people who are currently under the influence? And so my question, I look at the Milestones model in Portland. That's one particular model, but I'm wondering, when we're sending our law enforcement officers to respond to public nuisance issues that maybe they're not completely trained in order to provide these supports. I guess the question is, when folks get high and they're in the community, is there any type of program that's being run to provide supports?
Well, the one thing I would clearly point to is the proposal that we're going to have a crisis receiving center in Lewiston. I was disappointed that we lost 2 of the 4 in the financing, but the 2 that we kept were Lewiston and Bangor. Thanks. And I know that RFP is done. I think the time's expired. People have applied to do it, and the living room is the example, is what we call it in Portland, and it's really made a difference. And it is a place where public safety and first responders can take people to, they're not beds, but it's 24/7, and there's 24/7 professional behavioral health staffing there for mental health or substance use. So, I mean, you've got help, I hate to come from a guy say, you've got help coming, but you do. And, you know, that RFP is being scored as we speak.
Thank you very much.
Maybe I can just add that part of my outreach work in Bangor in response to the outbreak there is been engaging with the options team as they do community outreach at shelters, other community places, particularly engaging people maybe in active use, certainly have substance use disorder, and engaging them in the process of thinking about treatment and recovery and actually connecting them when they're ready. So similar to the services of SSPs.
Thank you.
I'm sorry, what was that? Yeah, if you'd like to, please come back up.
As part of the grants that I oversee that are community outreach based, I do monitor the Androscoggin County Options Liaison Program that both Ann and Gordon had spoke about. So we have 3 liaisons that hit the streets of Lewiston each day, as well as a recovery coach that try to engage individuals. We have the Project Support You program as well. I oversee that. There's capacity for 7 liaisons across the city and also across the river. We have a community health worker that works with New Maynard population. We have a housing advocate, and we have a harm reduction clinic, obviously, with 3 individuals. And probably maybe forgetting a couple of more of my staff, but there's about 15 people that are engaging actively that Spurwink has the contracts for, that are working with folks that are not just voluntarily coming into services. So we're going to where they are. I just wanted to add that.
Thank you.
Any final thoughts, Gordon or Councilor Longchamps? Did you have something?
Hi, yes, thank you so much for being here. The question that I have is
The mic a little closer to you.
how often do you inspect the organizations or the places that are distributing the needles?
So once they're certified, we would visit them, do like a friendly site visit. We attempt to do annually. We have monthly check-ins where we're talking with them via video conference, and then we have a quarterly check-in of all SSPs where they're able to hear from each other. If we receive a complaint, particularly if a complaint is of a serious nature, we would potentially do an unannounced site visit during their operating hours and seek to review all their procedures, their documentation, and then also particularly provide them the information contained in that complaint so that we can hear their direct response. The site visit would also look at all of those requirements of their regulation and would result in a site visit report where they would be required to respond.
Thank you.
Any final thoughts, Gordon?
Only to reiterate, we want to work with you. We want to address the problems that you're concerned about. We want to find this balance. If you choose to go down the ordinance route, we'd like to work with you on the ordinance. And we really appreciate the time. We realize we overstayed our welcome, and we really appreciate you listening to what we had tonight. Thank you.
I really appreciate you being here, Gordon, and all of the rest of the presenters. And I noticed there's a lot of recovery professionals in the audience, and I want to thank all of you for the work that you do every day for our community. Thank you all for being here. Yes, we are. We still have a meeting to get to. We're going to give ourselves a few minutes, and then we're going to get right back at it. Thank you. Hello, and welcome to our Tuesday evening meeting. We're going to kick things off with the Pledge of Allegiance, and we have Catherine Ryder here from Spurwink who will lead us. Thank you so much, Catherine. Madam Clerk, I believe we're ready to begin.
Yes, sir, thank you. All roll call votes for this meeting will begin with the Councilor of Ward 4.
I understand we have minutes.
You do, of the May 20th meeting.
May I have a motion to accept the minutes?
So moved.
Councilor Gallant, seconded by Councilor Stoll. Madam Clerk, please call the vote.
Councilor from Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7-0.
Thank you very much, Madam Clerk. We are now up to public comment. Any member of the public may make comments regarding issues pertaining to Lewiston City Government. This period is reserved for non-agenda items. Public comment is also allowed during individual agenda items. Public comment is limited to 3 minutes per person. Please state your name for the record, and please indicate if you're a Lewiston resident. Because this is the business meeting of the City Council, all questions should be directed to the mayor, who has staff to follow up at a future time. It is illegal for the City Council to allow comments related to personnel matters. All personnel complaints should be made directly to the City Administration Office.
Hi, my name is Lisa Jones. I live in Ward 2 and I own a business in Ward 7. I'm here tonight to talk about my disappointment with the public comments email address. We are often directed to comment there, and I sent a lengthy email to that address when I first saw the agenda for the previous council meeting. After an appalling unanimous vote to give taxpayer dollars that will never be recouped to political cronies, I learned that my email did not even reach the entire council before the meeting. For the benefit of the public, the content of my email was as follows. Dear Council, I've had a rough week at my childcare, and I don't have a ton of energy to dedicate to you, but I feel I must speak up about the possibility of you loaning $150,000 to an out-of-state company who already has a successful business to set up shop here in Lewiston. There are many reasons why I think this is a bad idea. In no particular order, there's no parking. It's next to the Church of Safe Injection / where people are actively impaired by drugs. Rusty bus failed and they had no rent. You'll be in last place on the loan and you'll never recoup the money. This sets a terrible precedent. As you may or may not know, I worked for years to find a location and obtain funding to open a childcare center in our city. I serve children from a variety of demographic backgrounds and a bunch of children with disabilities who attend local public schools. I actually provide a service to the community and provide jobs. And none of you were willing to help me dig up East Avenue and put in a sprinkler line so I could open here. When it comes to agenda item number 13 on last Tuesday, you can choose to waste Lewiston taxpayer dollars on a venture that is sure to fail, or you can choose to be responsible. That was essentially the end of my email. I've suggested to this entire council since you were sworn in that the public comments from the email need to see the light of day somewhere, perhaps by being published on the city's website. I was assured 16 months ago that they were working on it. We're still waiting.
Further public comment?
Good evening, Matt Roy, Ward 3. I guess I'll piggyback on that. There's been recent comments reported in the news media by various city officials, councilors, the mayor, which seem to be provide lip service. It is now June of 2025, and thanks to the inside-the-box charter changes, which somehow passed as a revision within the four corners of the charter, and not a charter commission, that's a story for a different day. But traditionally, candidates seeking election in this city in about a month to 6 weeks will be able to go visit the city clerk and office and get petitions. So four of you are up for election, and basically providing lip service. There have been various people, business owners like Lisa, the recent new owner of Luigi's, Zach Pratt, and via other non-in-person communications, i.e. the Downtown Business Association. And apparently the mayor and several councilors have paid lip service in quotes reported in the media, which that could shorten your political futures and should be abided by, since we are your boss. Thank you.
Andrew Jones, Ward 2. I'm here tonight to speak about a couple of things that this council has done and not done lately, which has angered me. I'm going to start with my ward rep. Susan, I've written to you twice last month and never gotten a reply on either, and neither issue was mentioned at council. If you're not going to interact with constituents and you're not going to bring their concerns to council, why are you here? Since my rep didn't broach this, I guess I'll do it here, and Lisa did earlier. There is a concern in the community that email to the city's public comment email address goes largely unaddressed and unacknowledged. I would like to see an agenda item dedicated to recapping public comment emails that come in so that their voices aren't only accessible via a FOA request. I wouldn't expect them to be read word for word. A brief synopsis similar to how in-person public comment is presented in the meeting minutes would suffice. Perhaps they could also be published on the city's website, similar to how the state publishes public testimony for and against various bills. Moving on, last meeting's discussion about the $150K loan to Democracy Brewing is another thing that earned my ire. I get that this council wants to appear business-friendly, and while I understand and encourage that, I implore you not to make poor decisions in the process. The city's underwriters rejected this as a bad idea. The economic development director admitted that Democracy Brewing's projections were overly optimistic, but that got brought to council and passed regardless. Not a one of you raised any concern about the unsecured nature of the loan, the underwriting which recommended denial, or the overly optimistic projections. Instead, we heard Carl talk about food. What appears to be a poor financial gamble is apparently a political decision, as Democracy Brewing is steeped in liberal activism and fundraising, which may be why so many people in positions of power are willing to ignore the issues and push this through. Lastly, LPD's Facebook page. So far, only the new city administrator has committed to looking at the issue. I've been here twice to speak about it and emailed both the council as a whole and my ward rep. Does anyone here care about freedom of speech? Your silence on this matter is deafening.
Good evening. My name is Denise Dumont. I'm here to speak on behalf of my mother, Claudette Dumont. I have handouts for all of you to see some visual as I speak. My mother is an 86-year-old lifelong Lewiston resident, taxpayer, and former small business owner until her retirement, as was her late husband, my dad, Paul Dumont. My mom's address was 4 Old Lisbon Road in Ward 6, for the past 20 years until 2 weeks ago when a vehicle crashed into her home, causing irreparable damage which took the life of one of its passengers. My mom was sleeping in her bed at the time. The home has been condemned by the city as a result. She has been displaced, and the trauma and the consequences are great, financially, emotionally, and physically. She is disabled and walks with a walker and could not be here tonight without breaking down in public. This is not the first time that my mother was traumatized by a vehicle crashing into her home, and this was not the first fatality on their property. I am here to express my extreme frustration, disappointment, and ongoing concerns that the City of Lewiston has not addressed the speed and the dangerous curve despite multiple requests. 2 years ago, in January 2023, another vehicle crashed into my parents' living room after a high-speed police pursuit and led to my father's heart failure and passing a few months later. I have been in contact with Public Works, the city traffic supervisor, and police administration on multiple occasions since that accident 2 years ago. They were informed of subsequent accidents that occurred in April 2024, in May 2024, in April 2025, each with requests to address this curve with speed bumps, a stop sign, a dangerous curve signs, whatever. My last email to this group on the morning of the latest crash went unanswered. Instead, 1 week after the latest accident, subsequent remedial measures were taken to replace the damaged and add a new chevron sign. Chevron signs do not stop speeding vehicles from hitting homes. This accident could have been avoided. I am requesting the following actions from the city. Please, place speed bumps on Webster Road to slow the vehicles and protect the property and the residents of the people who live in the area. A vehicle that speeds over these bumps, the vehicle will have the damage and not the home. And I also would like to see the installation of a solar-powered speed-aware sign. These solutions would cost less than $5,000 by my estimation, and not the cost of a home that she is now homeless with. Alternatively, redesign of the road to eliminate the short curve altogether. If this was a state road, DOT engineers would have been out there redesigning the road long ago. It is time for the city to finally address the speed on this curve. Her home has been condemned by the city. We requested property tax release for her, and as of yesterday, it has been denied by the tax assessor, citing state laws. This is simply cruel to impose on one of your lifelong residents, a taxpayer and a victim of a crime that she did not ask for, and this has happened to her twice. She and my father worked their entire lives to pay their home off and be mortgage-free in their retirement. Monthly rent payments will be much more costly than their mortgage-free home was. She won't go back to that home. I would like to see our local officials finally take action on that dangerous curve somehow. And I would like any information on what can be offered to my mother, a longtime resident and taxpayer of Lewiston, any resources available to her to support her for the rest of her short life that may be available to her, including the property tax abatement, since the home is irreparable and condemned by the city. She's the victim of a crime and the inaction of the city over the years, despite multiple requests to do something. I would appreciate outreach and a meeting with us and my family and my brother and my mother to do something about this curve. Thank you.
Hi. I'm really short, so let's see. Okay. I'm Joni Fredericks. I'm a resident on Old Lisbon Road, and I'm here in support of our neighbor. But also, you know, if we're considering Old Lisbon Road, it's a speedway. We own the property right after the marsh. We're on a straight stretch, and 35 is not the speed limit that is adhered to on that stretch. When people come over the hill, going towards Lisbon Street, or coming from Lisbon Street, they can come over the hill before they hit the curves going down towards their residence. They just kind of open it up, and that means 50, 60, sometimes 70 miles an hour. And we know that because we can't even catch a license plate because they're going so fast on that strip. So, and our concern is homeowners. I have a little dude, and he doesn't play in the front of our home because every year, at least 4 or 5 times a summer, we have people on our lawn. So they come up over the hill, they miss the curve, they are on our lawn. And the impact to us, sure, that's so little, sure, he can't play out front, that's not a big deal, we have a backyard. But, you know, our hold on, there's a word, septic tank, thank you. Yes, that thing. It's in the front of our yard. So when they come up over that hill, thankfully no one has landed on our leach fields, but if they did, that's, we've already sunk $30,000 into this septic system. So if we could not put more, that'd be great. And we were told by the city that we couldn't put large boulders because they'd have to be so close to the road that it's within the city's, like we can't, there's not enough setback there before it goes down the hill. And so there's really no way to make our front yard safe or to make people stop driving on it. So if we're throwing in speed bumps, we, you know, maybe that would help if it's on the end of Webster Street, if they're slowing down there. I don't know. I don't have the answer. But if our engineers are looking at that road, cops can also sit in my driveway. they'll meet all their quotas. Like, I'm just offering it up. I don't know if that's possible, if they're allowed to do that, but they can sit on my lawn, they can sit on my driveway. We'll bring them coffee. I don't know, but we would really appreciate some help from the city on that road. Thanks.
Administrator O'Malley, can you please give that speaker my business card? If you can email me your contact information, I would appreciate it.
Good evening, everyone. My name is Jay Zimmerman. I live in Ward 5. I'd like to just take a couple of seconds to thank both of our residents who just spoke. Speeding is a really serious issue that we see in Lewiston, and I will have another public comment on that at another time. I don't want to take away from the seriousness of this personal issue. I think it demands immediate attention. I am going to talk on a slightly lighter subject, thinking about Councilor Roy's remarks at the end of last City Council meeting. I've been thinking about how we might be able to maintain a 4-day work week for city employees without reducing hours of services for residents. I did a little bit of research into this. Iceland has implemented a 4-day work week across all sectors, pretty much 90% of the population. And there are domestic examples as well, but that's just the one that caught my eye. And it's had really vibrant success in terms of quality of life and work satisfaction. There are some options. The simplest is probably to alternate a schedule of some city employees work Monday through Thursday, some work Tuesday through Friday. Therefore, we maintain the schedule of availability to residents. We could get creative and actually extend the hours by scheduling offset shifts, a practice that's done in the private sector very successfully. I've been employed in that way as well. So some people work 7 to 3, some 9 to 5, some maybe even 11 to 7. This is relevant for a lot of our residents. I think about in my case, I teach at one of our fine Lewiston public schools, so I can get off work at 3 o'clock, make it down to City Hall by 3:30, no problem. But if I had a schedule like my wife and I worked easily till 5 or 6 at night and I had a half-hour commute, and that was both of us, it would be really challenging to conduct our city business within the regular time frame. So I think, just to summarize, it is possible to both maintain this groundbreaking 4-day work week, which does improve quality of life and job satisfaction and job retention for city employees, and maintain or even expand access to services and ability to conduct city business for residents. So I'd like to present those for your consideration and look forward to hearing what you come up with. Thank you.
Mr. Mayor.
Hello, yes. Yeah, Councilor Chittum.
Our 18 minutes for initial public comment has long since lapsed.
Thank you. Yeah, without strong objection from the council, I would like to just work through what I'm sure are the last couple of remaining speakers.
Okay, thanks. I'll make it quick. Zoe Lidstrom, Ward 5. Just wanted to respond to an article that I read in the Sun Journal about the efforts to kind of address trash issues in Kennedy Park. Really appreciate Administrator Cainrath's leadership on that, and the fact that you know, something might be done about that. I would just say that the extent to which we can have sort of as many trash cans as possible available to the public and make it as easy as possible to throw things away would be great. And I would love to see like cigarette butt disposal containers. You know, the discussion about needles earlier notwithstanding, I think that cigarette butts are one of the most pernicious drug-related trash that we see around the city. So that would be one great thing to add. And then regarding graffiti and addressing that issue, I see a great opportunity for more public artworks around the city. I love the ones that currently exist on buildings or on sort of like utility boxes. And I think that's sort of a win-win-win. You can support local artists, make things look amazing, and also kind of take away some of those bare concrete walls that are just begging to be tagged. But by and large, my comment is just about, you know, thanks for addressing this issue. I love Kennedy Park. I walk through it to downtown regularly, and it's a really nice park and only going to get nicer. So thank you.
Further public comment? Public comment is now closed. Madam Clerk, item number 1.
Actually, Mr. Mayor, we have the city administrator's report first.
Oh, that's twice now. I apologize, Administrator.
Is that it, Mr. Mayor? You keep
please,
skipping me.
Please proceed with your report, sir.
Thank you.
So my next public listening session event will be held on June 10th, 5 to 6:30 at the Geiger School. I'd like to encourage all residents and local business owners to join me to share their thoughts, views, concerns, complaints, or anything else you'd like to share with me. And again, we are trying to rotate these events at different locations around the city to make sure everyone has an opportunity to participate. Tonight, I am also announcing my intention to form a staff-level blight reduction team to better focus on blight and aesthetic problems around the city. Blight will include maintenance of lots, unsecured buildings, graffiti, litter and trash, dumping, and a host of other unsightly problems around the city. This is a part of a multi-pronged approach to improve the city's image and something that will literally, I think, change the look of many areas of our community. So I'll have more updates on this in the weeks ahead of what that team looks like and our strategy going forward. Moving on to Kennedy Park, and we have received a lot of, I think, good public positive feedback of things happening in the park the last number of weeks since we talked about a new strategy to address some of the maintenance and behaviors we're seeing in the park. So I want to thank city staff for their efforts over the last number of weeks. This is going to be something that doesn't happen overnight. It's going to be baby steps, but I think we are already seeing some positive feedback. We've had some great media attention on the cleanup, and I think it's overall been a positive story for the city so far. But just to reiterate for the public, Kennedy Park is not a place for drug use, for getting drunk, for engaging in other illegal activity. It's not a place to dump trash, spray graffiti, or engage in other acts of vandalism. This is a beautiful park. We're going to start treating it as such, and it's going to be open and welcoming for all residents of Lewiston and our visitors to enjoy. So some good work there, and I think we're just getting started, much more to come. On graffiti, just a reminder, please forward any reports of graffiti. We are making an effort on this directly to me or to our Public Works Department, or we're going to be vigilant about getting on top of this and cleaning up the tagging. So thank you to our Public Works Department for their participation also. Again, I think we're already making some progress. It's not going to happen overnight, but we have to start somewhere. So thank you very much. Also, I just want to thank Public Works for their sweeping efforts this spring. As you saw from some of the reports out, we've completed sweeping at a much earlier timeline this year. Streets look great earlier than ever, so thank you for their efforts there. Again, this is all part of a multi-pronged approach to keep the city looking good, clean, and putting our best foot forward. A couple quick employee updates and milestones to announce. Colby Gagne, a new employee in Public Works as an equipment operator. Congratulations, Colby. And also Jacqueline Sawyer in our our Community Development Department as the Assistant Housing Manager. Welcome to Jacqueline also. Lastly, I just want to say my last few weeks have been chock full of meetings, and more meetings, including staff, area elected officials, residents, community groups, nonprofits, business owners, educational institutions, and many others. I've really enjoyed meeting you. I've really enjoyed hearing your perspectives, gaining some insight. This has been an incredible opportunity to get out into the community and hear what's actually on people's minds. So thank you to all of you for your frank conversations and all the things that you told me about the great city of Lewiston. For those of you still on the schedule upcoming, of which there are many of you, I look forward to meeting you and seeing you soon. So the work goes on. Thank you. Appreciate it.
Thank you very much, Administrator Kinrath. We appreciate you. Okay, Madam Clerk, I think we're up to number one.
Yes, sir. Item number one, public hearing and adoption of order approving outdoor entertainment event permits for various summer community events. Requested action to conduct a public hearing on applications for outdoor entertainment event permits and to adopt the order approving outdoor entertainment event permits for various summer community events.
May I have a motion, please?
So moved.
Councilor
Second.
Bland, second by Councilor Najin. Discussion among the council? Public comment for this agenda item? Back to the council. Madam Clerk, please call the vote.
Council from Ward 1. I'm sorry, Ward 4.
Yes.
Ward 5.
Yes.
Ward 6.
Yes.
Ward 7.
Yes.
Ward 1.
Yes.
Ward 2.
Yes.
Ward 3.
Yes.
Motion passed by a vote of 7-0.
Thank you, Madam Clerk. And now I think we have 1B.
1B, yes. Thank you for letting staff add an item last minute to the agenda. Item 1B, public hearing for approval of outdoor concert on Lisbon Street sidewalk sponsored by El Pocho's Restaurant. Requested action to conduct a public hearing on an application from El Pocho's Restaurant for an evening outdoor concert to be held at 97 Lisbon Street sidewalk on Wednesday, June 4th and to authorize a permit for an outdoor entertainment event as required by the City Code of Ordinances, Chapter 10, Article 1, Section 10-3, to El Pochos for the outdoor concert, contingent upon positive recommendations from the Police Department, Fire Department, Code Land Use Officer, and Code Health Officer regarding compliance with all regulations and compliance with all city ordinances.
May I have a motion, please?
So moved.
Councilor Chittum, second by Councilor Harriman. Discussion? Public comment? Back to the council. Madam Clerk, please call the vote.
Council from Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Absolutely.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7-0.
Que bueno. Item number 3. Two.
Item number two, public hearing and final passage for an amendment to the zoning and land use code, Article 5, administration and enforcement to temporary on-site housing during construction for owner-occupied housing. Requested action, that the proposed amendments to Appendix A of the Code of Ordinances, Zoning and Land Use Code, Article 5, administration and enforcement regarding temporary on-site housing during construction receive final passage by a roll call vote.
May I have a motion, please?
Second.
Councilor Glant, followed by Councilor Chittum. Director Connor, please kick us off.
Thank you, Mr. Mayor and Council. As you recall, this is up for its second reading. This is an ordinance that would give some allowances for folks to put a temporary lodging or a temporary housing unit, such as an RV or a camper, on their property to build on a vacant lot. We have received no further questions from either the council, staff, or the public on this matter.
Thank you, Director. Comments, questions from the council? Public comment? Back to the council. Madam Clerk, please call the vote.
Council from Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7-0.
Thank you very much, Madam Clerk. Now we're up to number 3.
Item number 3, public hearing and final passage for an amendment to the zoning and land use code, Article 12, performance standards regarding changes to allowances for some home occupations. Requested action, that the proposed amendment to Appendix A of the Code of Ordinances, Zoning and Land Use Code, Article 12, performance standards, receive final passage by a roll call vote.
May I have a motion, please?
So moved.
Second.
Councilor Najin, second by Councilor Chittum. Director Connor, please kick us off.
Thank you, Mr. Mayor and Council. Same for this ordinance. It's an ordinance that we brought forth to make it easier for some home occupations. Again, we have not heard any further comments or questions from the council staff or the public on this matter.
Questions, comments from the council? Councilor Najin.
The only comment is I'm really appreciative of these changes. I think it's supportive of some of the small micro businesses in the community, so appreciate it.
Thank you.
Public comment. Back to the council. Madam Clerk.
Council from Ward 4?
Yes. Madam Clerk, please call the vote. Thank you.
Council from Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7-0.
Item number 4.
Item number 4, public hearing and final passage for an amendment to the zoning and land use code, Article 2, definitions for changes to the definition of single-family dwelling and the addition of a definition related to home businesses. Requested action, that the proposed amendments to Appendix A of the Code of Ordinances, Zoning and Land Use Code, Article 2, definitions regarding single-family dwelling and home businesses receive final passage.
May I have a motion, please?
Moved.
Second.
Councilor Glant, second by Councilor Chittum. Director Connor.
Thank you, Mr. Mayor and Council. This is changes to the definitions for the previous ordinances that we made, as well as the changing of definition for what could be considered a skinny home, the ratio. And again, no further comments or questions from staff, council, or the public on this matter either.
Thank you. Councilor Chittum.
Thank you. At the first reading, I thought we had some comments on the 16-foot minimum width. I don't want to hold this up on the second reading, but I would like us to explore whether or not that 16-foot minimum width is really necessary.
Okay, I will. I thought that that was addressed. I apologize. I will get that answer.
Public comment for this agenda item. Back to the council. Madam Clerk, please call the vote.
Counsel from Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7 to 0.
Item number 5.
Item number 5, I will point out that you had replacement orders, I think at the dais or on your chair or mailbox. We basically have 2 orders, one for the Farmers Market and then another order for Balloon Festival Dempsey and Liberty Festival. So the item number 5, orders establishing the 2025 festival zones for the Lewiston Auburn Balloon Festival, the Dempsey Challenge, the Liberty Festival, and the Lewiston Farmers Market. Requested action to approve the orders establishing the 2025 festival zones for the Lewiston Auburn Balloon Festival, the Dempsey Challenge, Liberty Festival, and the Lewiston Farmers Market.
Have a motion, please.
So moved.
Councilor Chittum.
Second.
Second by Councilor Najin. Discussion among the council. Questions? Councilor Chittum.
Thank you, Mr. Mayor. Is there anyone in favor of creating a permanent festival zone in the zoning ordinance? We seem to do this every year, and I wonder if there's enough flexibility. If we require flexibility to go through this process annually, or should we just establish in the zoning ordinance a festival zone or zones?
I'm going to defer that question to the Deputy City Administrator, who serves as the staff liaison to festivals and special events.
I guess we need to change how we do this, our policy. Excuse me, but I think last year we did this twice because it was initially Great Falls Balloon Festival, then it was LA Balloon Festival. Farmers Market, we have an MOU with them through 2026, I believe, so that could change if their location changes. Now that we've got the order straight, Councilor Chittum, I think we better just kind of repeat this every year as we move forward. If we change it, it's just based on if we don't have the events. And if we had something bigger that would come in, I just think we might as well continue to do it this way. And remember that you're just approving the order, not so much the map that we sometimes struggle to make a match for what we're actually describing in the order.
Thank you, Deputy Administrator.
We appreciate your efforts. Councilor Najin.
And there is a possibility that if we change some of the application processes, maybe some of this changes as well, correct?
That is our goal, to kind of streamline our application for outdoor entertainment. And I think the example with El Pocho's where they came to forward and say, hey, we want to have a mariachi band next Wednesday. And we're like, okay. And there's a whole process we have to go through. But that would require the city council giving up some of their approval power if we change how we do the outdoor entertainment
Our
permit.
power
So
and
that's,
authority.
I think, a discussion for a workshop day, not tonight.
I would like the record to reflect that I'm always on board for a mariachi band. So, public comment for this agenda item. Back to the council. Madam Clerk, please call the vote.
Councilor from Ward 4?
Yes.
5?
Yes.
Ward 6?
Yeah, this is for both orders, is that correct?
Yes, sir.
Yes.
Thank you. Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7 to 0.
Item number 6.
Item number 6, order approving the disposition of 112 and 115 Shawmut Street. Requested action to approve the order approving the disposition of 112 and 115 Shawmut Street.
So moved.
Yes. Thank you, Councilor Glant.
Second.
By Councilor Chittum. Thank you. Discussion? Public comment? Back to the council. Yes, Councilor Najin.
There is plan to build housing on these units, that's correct?
Correct.
Yep, okay.
Further discussion, comments from the council? Madam Clerk, please call the vote.
Council from Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7 to 0.
At this point, I would like to move up item number 9 to now, if that's okay with you, Madam Clerk, and without strong objection from the council. We have our presenters here, correct? Perfect. Director Libby, can you please kick this off?
Good evening, Mayor and Council. My name is Nate Libby. I'm Director of Economic and Community Development. I'm here today with two folks from Camoin Associates, Jim Demesis and Alex Tranmer. They've worked with us over the last, I'd say, 10 to 12 months on developing the strategy. They're here to present some of their findings and recommendations to you. This document is primarily designed to support staff as well as our partners in following a strategy to attract investment, improve housing, and increase overall economic activity in our city. The funding for this project was approved by your predecessors on the council. The project was kicked off by my predecessor, Link Jeffers, and I sort of helped steer the process prior to his retirement and through to today. John Blaze, our Deputy Director of Economic Development, is here in the audience. We're going to turn the microphones over to our consultant team to review their findings and recommendations, and we're all available to answer questions you might have.
If the two of you could please introduce yourselves and then proceed.
Absolutely. I'm Alex Tranmer with Camoin Associates, Director of Industry and Workforce, and my colleague Jim.
And I'm Jim Demesis, Senior Vice President of Camoin Associates.
All right, so what we've got for you today, we know we want to get right into what's in the strategy and get to some Q&A. We just want to set up how we got here, the process we went through, the data we looked at, the engagement that we did. You've got the slides here in front of you. I know you've got access to the plan as well. So we're going to take a 30,000-foot view to give you the highlights. Happy to answer any questions from there. I do think it's important to talk about the data that we used as part of this, both quantitatively and the engagement that we did directly with businesses over the last couple of months. Lay out what the competitive factors are that Lewiston is capitalizing on through this plan, and then ultimately what's in the strategy and how it's going to move forward. Just starting at the beginning, why this matters now, why do an economic development plan, why lay out all of these priorities both internally and with the city's partners. I think it's fair to say that the city is really at a turning point, and this is about a momentum shift and a sort of adapted approach to economic development, certainly increasing the integration of all of the work that's ongoing with housing, with collaboration with partners, with public safety. All of that all integrates into the opportunities for economic development. In addition, I think it's important to point out that the way that businesses operate, the way the competition around small business development in particular, it's high. It's high in Maine, it's high in Lewiston, really across the country. And so this plan really lays out an opportunity for Lewiston to use its assets to its advantage and to help its businesses remain competitive in the marketplace. Again, just laying out briefly how we put the plan together, looking at three different components here. So, of course, our data analytics. So, Camoin Associates, we are a data analytics firm. And so we look at both historic and current data to help set the stage, to help understand not just what's happening in Lewiston, but what's happening in context in the region, in the state, and again, across the country. And so whether that's on the community side, demographics, whether that's on the industry, labor market, workforce side, entrepreneurship, understanding what those trends are, all of that helps build the foundation for where to go. On the engagement side, we did a couple of site visits to the city. We had focus groups, we had one-on-ones, talked with partners, talked with staff to really understand, the data is a starting point, but it certainly has gaps, and really figuring out the reality of what's happening on the ground is important to reflect as well. Lastly, just on the strategy development side, this obviously has to fit into the larger picture of the city. So whether that's the comp plan, master plan, reflecting all of the investment and work that's going on in housing, this strategy aims to leverage all of that work as well. All right, looking at some of Lewiston's competitive factors, again, based on the data conversations, our work all across Maine and all across the country helped to inform some of these components. A few things to highlight on this slide here. I will point out, just on the demographic side, the young growing population is a pretty unique asset and feature of a community in Maine. It's really not the trend that we typically see. And that talent, that youth, that really has great opportunity within the city. I will say overall that I believe it was a 7% decline overall in employment in the last 5 years. And a lot of that has to do with COVID-related impacts. However, even though employment was down overall about 7%, manufacturing, construction, and transportation all grew over that 5-year period. So we're seeing, despite overall job loss, that there's still competitive businesses and assets in those manufacturing, construction, and transportation areas, that those areas are still growing here. And that's important to recognize because, again, that's not happening elsewhere or everywhere else in the state as well. Again, just recognizing that housing is a critical component of economic development. It's right, the two are just so integrated that without places for your employees to live, your business owners to live, you really are going to struggle at supporting economic development. So there's already a recognition and investment in housing for economic development, and that's a huge asset in Lewiston. Lastly, I'll point out walkable downtown and the connection to the waterfront. Those are geographical assets that are exciting, unique feature of Lewiston and opportunities to build on there within the strategy. Lastly, before we get to the strategy itself, obviously we need to recognize some of the obstacles that are holding the city back to take advantage of those assets that I just listed. Certainly we talk to businesses and workforce. That's what everyone's talking about after housing. Continues to be at the top of everyone's mind. I would say nearly every business we talked to said that they would hire between a few to a dozen employees if they were able to find them. So that's positive, right? There's opportunity that the businesses are ready to hire, but the challenge in finding employees is obviously an obstacle that holds back economic potential. So we talked about some, coordination around workforce in the strategy, sort of lingering perceptions of the city. Those are very real, both internally and externally, I would say. On the real estate side, while there are certainly unique assets within the mills and opportunities for unique investment, that obviously comes with a price tag. And is challenging to redevelop, but certainly an opportunity. Lastly, I think we just need to recognize and acknowledge that certainly the impacts from October 25th, from ongoing recurring public safety concerns, that those have implications on the business community. Those were very real when we talked to businesses themselves. And so again, just recognizing that that's an ongoing communication role for this plan moving forward. All right, Jim, over to you.
Yeah, thank you. And just one quick note on that previous slide.
Can you move the mic a little closer to
sure.
you? Or
Yeah.
roll a lot closer, really. Thank you.
How's that? It sounds really loud, so I'm good though if you're good.
Sounds great. Please continue.
Yes, thank you. So when we've talked to communities and businesses all over the country in the course of our work, and usually, quite frankly, lately it's all about workforce, but then it's sometimes about overall business environment, and then like particular things with land use and zoning. When we talked here, and this gets to what Alex was saying, pretty much top of everybody's mind was public safety. If there's one thing the city can do for economic development is public safety. And frankly, one of the communities, there's some cases that are in the report that you have that we've put in there about places with either continued high crime and how they are dealing with it, or public safety trauma events and how they were dealing with it. So there's some lessons in there from that. So anyway, I just wanted to recognize that and make sure that that was unique in the sense that it was recent and continued to be impactful, and an issue for the community as a whole, but also an issue for workers and the business community as well. So next slide. So There's quite a bit in this report around strategy, and I'm going to try to give you the high-level overview, and then we're here to answer any questions that you have. So there's 4 goals up here, but there was 5 goals total. The 5th is on the next slide. And let me just hit some of the highlights. So the first one, and there's a set of actions for every single one of these, and then the actions are categorized by the next 6 months, the next 2 years, and then beyond the 2 years, so that it becomes an action plan for the department, as Nate had mentioned. This is meant to serve as a public document, obviously, but most importantly, a work plan and action plan for the department. And so with that said, the first area is retaining existing businesses and promoting local growth. So that's about understanding and supporting your existing businesses. Sometimes overlooked by communities. Here that generally there's been a program of making sure there's outreach to businesses and property owners around their business concerns and their business needs. One thing we'll say that we recommend is getting a bit more formal with what's known as the Business Retention and Expansion Program. So when you talk to your businesses, making sure that what you learn from that gets captured digitally so that over time you can mine that data and use it for changes and adaptation for action and policies. So it's all about, today's world in economic development is all about getting smarter for economic development and using data, and that includes your Business Retention and Expansion Program. Not just for attracting companies, but staying with the idea of supporting existing companies. If they want to expand, they want to know what's available for expansion, either at their site, but also other sites. And we heard that from some of the businesses. And if they don't find it right away, they're going to look to other places. They're going to look to Auburn, obviously, but they're going to look to other places in the region and throughout the state. They generally want to stay in the community that they are because it's a lot easier to stay local than it is to move far away. So the more that you can do to make sure that you have a really good handle on your sites and your properties, and that you market those constantly, because not everyone's aware of them all the time. You got to keep that up to date. And then finally, one of the things that's in there, and again, these are some things that you're doing. We're talking a bit more about doing it more formally and building out more of what you're doing. But the final piece on this one is having a business concierge service, so that when there's a concern or anything for a business, that they express. However it comes in, whether it comes in through one of you or whether it comes in through directly to the department itself, that gets logged, acknowledged, and followed up with, and then there's a suite of services that can be deployed to help that business. You may not always be able to help them, but at least you can explain. Let me keep going. I don't want to dwell on any one of these too much. The strengthening the entrepreneurial assets and culture. Maine and Lewiston are built on small businesses and entrepreneurs. You have a lot of small businesses, some that are doing very well, but it's also a high risk for people, and many fail over time. So it's always important to provide a supportive atmosphere, but more importantly, it's either through combination of financing programs or access to financing programs. The state has done a much better job lately at providing like one-stop websites and like services that say what programs are best for you for funding at the state level if you're a business. So making sure that you provide that access is really important. And then the other thing that you have as an asset is a very diverse culture here and population of entrepreneurs, and building on that energy and supporting existing Mainers and new Mainers in their development and aspirations to start and grow a business can really separate you from other communities. Next would be the investing in Lewiston's people. That's particularly true around the workforce. And as we mentioned, it's really important to do that. And you really can't separate workforce and education from supporting services like housing and transportation. commonly referred to as like wraparound services, daycare, healthcare, and so forth. So understanding the full package. And the good thing here is that one of our recommendations is specifically to work with and support the program of the Strengthen LA initiative of the Chamber. So they've put a lot of, not all chambers work on workforce development, by the way, but this chamber does, and that's a very good thing. And the city working with them for that, as opposed to starting new programs, is really important. And then fourth is, while I talked about retaining businesses and supporting your existing businesses, you also want to attract new investment and new businesses, and they need to know where the sites are and where the properties are, and they need to know that from your website, and they need to know it from the state's website that also catalogs sites, and then you need to regularly market those. If you don't have a good handle and you get inquiries and someone's asking for, boy, here's what I'm looking for, do you have that kind of property? And your answer might be, well, let me get back to you in a week. It's going to be too late. In fact, most time businesses or companies looking to move, by the time they get to you, they've done 70% of their work online, and so they need speed when they talk to you to make a final decision. And so it's really about speed and information, and then targeting too. There's a lot of work in the report that looked at industry data, and the focus areas are, in a good way, manufacturing, which has a renewed interest nationally, but you have a strong base in that, including not just from way, way back, but more recently, and you're doing fairly well in manufacturing. And so you can build on that, and you've got globally competitive companies here that are really part of the whole ecosystem. And transportation, warehousing, and logistics, because of your location, it's ideal in terms of the assets that you have, the location of the highway, the airport, et cetera. And then retail, a different kind of retail than maybe what existed 20, 30 years ago, but local retail is doing better, and that offers an opportunity to, and differentiating yourself from like big box retail and things like that. And then finally, healthcare. And if you look at the report, you'll see job losses in healthcare. It's pretty much due to the unique dynamic that has occurred between your two hospital systems, but overall you're still a healthcare center, and that's an important part of your future employment and even some small business development related to healthcare services. Next slide. The building, all of it, so the fifth goal area is building partnerships, trust, and capacity. It essentially cuts through all of the, it's the how-to of all the other goals, if you will. One is, you have to actively market. That includes on social media and getting the word out. And communities find this very difficult to do because of their own internal policies. And some of that's understandable, but there needs to be better ways to figure out how to get the word out about business stories and so forth. And the chamber does some of that, but the city needs to do some of that as well. And then communicate this plan. In other words, it's an internal document. This is a public process here tonight. But people want to know that you have a plan. They want to know that you've committed to some sort of actions over the long term and are doing something in the short term as well. So you need to really focus on getting the word out. Collaboration across partners and within the city departments. Every time you're dealing with a kind of a business issue, it's usually multiple departments within the city. Oftentimes it's some other agencies and organizations outside. So coordination is really important. And then like with your chamber, your downtown businesses, and your other kinds of organizations, you can't do it all, they can't do it all, and you all need each other. It's a very much a team game. And then supporting ongoing investments. Budget times are tough, and so you'll always be asked to support different programs for economic development that are going to be competing against many other high needs as well. It's just important to realize that these are important for continuation of services over time. And then it's really important to track your progress through your metrics and report those. And we offer a suite of metrics at the end of the report of what you should be tracking. One final thing in terms of that investment is other cities have this in Maine, but not all have a downtown. And a lot of places, I live in Scarborough, Maine, and we would love to have a downtown, and we don't. And it's near impossible to create one if you don't have one organically. And so investing in that and supporting it is important. And one way to do that is through joining up with the National Main Street Program, which does have some cost and resources associated with it, but it's a well-known best practice for how you support downtown organizations and the businesses. So what we did, I'm not going to read all of these, but I'm going to highlight it. I just want to make sure that you know that these last two slides that we do, and then we'll open it up for questions, are a lot of times strategies and the associated actions can be overwhelming. Boy, we can't do all of these things. We don't have the staff capacity. We don't have the budget. It's going to take us forever to develop some of these policies. We recognize that, so we put everything into action in terms of a time frame of immediate to 6 months, which is really focusing on the strengthening the internal coordination. And you have, as Nate said, new staff and a good team here. And they were phenomenal working with us, by the way, particularly on the strategy development and fitting it with what they felt the capacity could be over the next 6 months to 2 years. And so building on that and making sure that you're aligned in your departments internally and working on the, if you will, the low-hanging fruit, and then promote inclusive engagement and outreach by tailoring your programs to new Mainers, disadvantaged entrepreneurs, underrepresented communities. Oftentimes it takes extra to get that word out about what's available and how supportive the community can be, and that's going to be very important. And then building your strategic partnerships. Again, things like the public safety traumatized all of the organizations and different entities in the community. So focusing on those partnerships, working with your chamber, which I've been in Maine, I'm not here from Maine originally, but I've been in Maine 36 years. And the chamber historically has been very strong in this region, and it continues to be. And so it's like a very good opportunity to leverage that, partner with, and but them plus other organizations that also represent businesses and different kinds of constituencies. And so that's really important. In terms of the next slide, in terms of the 6 to 2 years, it's upgrading the Lewiston's brand and visibility through targeted marketing. That's going to require some resources for web page development, social media marketing, going out and explaining what's going on in Lewiston to other constituencies throughout the state and maybe even throughout the country. And then boosting that business support and marketing efforts through continuing your formal business engagement program, your digital marketing, your site inventories, and increasing and continuing the new to-be-developed business concierge service. And then continually work on, the final one is continually working on your workforce development pipelines. And I will tell you, again, you don't need to hear it from me as the consultant, you all see it in the news. This isn't just challenging times for workforce development because we've ignored it or something like that. We are in a major transformational shift here in terms of skills and education needed for the current and future workforce. A lot of it has to do with digital technologies and the way, and that's not just understanding tech, but how to work together, how to build teams, and how to communicate, and how to have social skills associated with that. And there's a whole bunch of new skill sets. Businesses don't necessarily know exactly what's needed. Education institutes do not, economic development organizations, we're all learning it together. So it's a continuation, it's a constant need for investment in workforce development, including at the city level. Next slide. That's pretty much it. Again, it's high level and because of the time, but I want you to know that we're here for Q&A now, but also obviously you have your staff, and if they have any questions, our team is going to be supporting them with responses to your questions as well. So thank you.
Jim, Alexandra, thank you so much. You mentioned, I think, Alexandra, you mentioned that you spoke with businesses, correct? How many total businesses did you speak to in Lewiston?
It was around 20. It's in the report, the exact number, but I'm going to say around 20 is
And
the number
then,
of businesses.
you know, were they small businesses, large business? Were they representative?
Yeah, we did a mix from retail to industrial to warehousing to Main Street to elsewhere in the city. So I'd say fairly representative of the business mix. And then in addition to businesses, also community-based organizations as well, in addition to the chamber. So business side and also the supporting organizations as well.
Yeah, and the chamber hosted a focus group, if you will. It was like an open discussion where we presented some questions, and they had about 15 or so businesses there at that as well. And we had help from your staff to help us figure out who best to talk to. But it was interesting because it was some of your larger companies, and some in tech, some in distribution, and then also like local Main Street companies as well. So we learned a lot from that. And we had the advantage of, while some prefer to do it virtually now, they don't even want you to come to their business, the fact that in this particular case, we happen to be local and I'm located in Maine as well as some of our other staff. And so we were able to conduct some of those visitations and interviews in person.
Gotcha. Thank you. Councilor Gallant.
Thank you, Mayor, and thanks a lot for the presentation and material. I have a slew of questions that I'll reserve for our Economic Development Director, but I guess what I'm asking is, probably to you, Director Libby, is when do we sit down with you for an hour and talk about this plan? I would like to see a scheduling program like Microsoft schedule with things across the board for the first 6 months, and then let's layer down, and that's how I operate when I did business, so we can see what we're going to tackle and work on low-hanging fruit, because the more we eliminate those, we can spend more time on the harder items and things that have to be taken care of. So I just, to my group up here of colleagues, that I'd like to say I'd like to be able to sit down with you after I've absorbed this a little bit more, and then maybe you can just start your timeline and make your priorities through the Economic Department so we have some kind of input. Thank you again, guys.
Sure. Is that a question for me to speak to?
Just for you to be aware that
Okay.
we're going to ask you to come for an hour and tell us more.
We're happy to do that. I just want to remind the council, you schedule yourselves 2 hours of workshops a month during the regular part of the year. And the summertime, it's more challenging. And so if you consider adjusting your workshop schedule, I think staff would welcome that.
So do you have the timeline already done?
So step one was the high-level presentation.
I'm teasing you.
Step-
When you're ready for us, timeline, and get your list of priorities,
Sure.
then you let us know, then I think, and then would be better to talk to you than to bring you in before you've had your own strategy. I prefer to see what you want. You've worked with them. They've given you good accolades, which I agree with. So put together the 0 to 6 month type thing and say, okay, I'm ready to sit down with you guys, and this is why I want to go through it. And that way, I think for myself, I'd be willing to be able to go back and forth, if it makes sense.
While Alex is pulling up the strategy implementation matrix, this is coming from the full report. It's 80 some odd pages. I intended to print color copies for tonight's meeting. I wasn't able to make my deadline, so we'll email this out to you tomorrow, and you'll have printed copies the next time you have a meeting. But to Councilor Gallant's point, we worked with the consultants to develop an implementation matrix that shows sort of who's involved, what kind of resources are required, and what kind of timeline we need. And then from that, built out strategies within each of these 5 steps to sort of lay out how do we tackle this. Because as was noted, there's something like 120 recommendations here. We have a staff of 8 in my office, 4 which focus on this. So we're going to have to get creative, but this is intended to map out how we get from where we are now to where we want to be. We're happy to have a session with you where we go into detail on that.
Yeah, and I believe, if you don't mind, I believe the direction is where we want to go, but out of the 120, 1 could be important, and 17 could be the next one, and 120 could be, so that's what I want to see, because if you give it to me, I'm going to pick things I like. And you're going to have 7 other people who are going to pick things they like. So I like to first see what you like, and then I'll still pick my own and see if we can't match things up so that we're all not chasing our tails, for lack of better analogies. So I want to know what you want based on what you talk with them, because they're the professionals and you're the professional, and me, I want certain things, and may not really be important, may not be a low-hanging fruit, okay? Could be right there on top. So I might need to be educated. Thank you.
Director Libby, you're saying you're in possession of this report now?
Correct. It's electronic, it's not printed. My goal was to have it printed for you tonight. I wasn't able to make that deadline.
Okay, but you're going to email it to us?
Tomorrow morning, yeah.
Perfect.
Yeah.
Thank you, Councilor Gallant. Yes, Councilor Najin.
So thank you very much for being here. Thank you for the report. I think a lot of this is for folks that have been involved in the community for a while. Is fairly common sense for what we're seeing we need in this community as well. I like the framework of it. Obviously, I'm going to have to read through the actual report, but I like the idea of scheduled reporting, identifying our inventories, communication with stakeholders in all of these places, and workforce development, because it's absolutely huge. I think you're right when you talk about light industrial and manufacturing. We're really good at that, and we have an opportunity to really expand, especially based on our reevaluations, which are going to be coming in shortly. But there's always the question of, do you have people who can use AutoCAD? Do you have people who, are CNC machinists? All of these pieces that we're going to have to continue to invest in our workforce, as well as drawing new people in. And, the overall, like I said, I got to read through the whole pieces, but this makes a lot of sense as far as the framework and also the timing and the reporting out on regular basis. So I'm very happy to see this.
We're going to public comment for this agenda item. Yes, Administrator Kane-Rath.
Thank you. Just a comment and then a question. First, I just want to assure everyone that we will be appropriately scheduling all departments in front of the council. That's not going to be an issue. So whatever time we need, we will find that's not an issue. Second, just a quick question on what is holding Lewiston back. I think we know about our public safety issues. We know about some of the negative external perceptions, but the low morale and trust. Maybe, Jim, can you expand on that, of what your kind of findings were, and just dig a little deeper on the morale and trust issue? Thanks.
Yeah, and Alex, jump in too, because it's, I felt like some of the comments that we received were just a feeling that the city overall, and again, these were perceptions. I'm not saying they're grounded necessarily in fact or truth. But a perception does matter. That was being unresponsive in quick enough time for business concerns, and then not enough regular feedback and communications about what's going on in the city versus understanding the business concerns. Now, that's not unheard of when we talk to other places, but it rose to a point where it made it to what we felt was a constraint. Yeah, and it wasn't about the public safety issue, which was a separate issue. It was specifically about, hey, the city goes about its staff. I'm not really sure what's being done. I'm not sure what's being followed up on.
You conducted these conversations with businesses over what time period, from when to when?
So this would have been October to early this year, so early 2025.
Okay.
And so to Jim's point and to the timing point, we were here in October 2024, right around the anniversary. So that certainly colored some of the conversations that we had, I think.
Thank you. We were heading to public comment for this agenda item. And now we're back to the council. Further comments or questions from the council? Any final thoughts?
If I may, and then I don't want to take over your time, I just want to stress that, again, while our work on this particular report ends, we're here for advisement as well. And happy to be working with any questions that come up and work with Nate, John, and staff and make sure that we can answer your questions. And just thank you for your time.
And in terms of next steps, Mayor and Council, our staff are digesting the full report. We intend to incorporate this as part of our Monday team meetings. What are we doing each day to make progress on these goals? I would ask, when you receive the full report and are able to give a little bit of time to reading through it, there are a number of recommendations around interdepartmental alignment on supporting our economic development. I think that's something we've worked hard at the last several months, but I think we have more work to do. And so I'd welcome further conversation on the strategy, the elements of it, where you'd like to help us, and how you'd like to shape it.
Thank you. Jim, Alexandra, or sorry, were you going to say something?
I'm all set. Thank you, guys.
All right, thank you both so much, and thank you to our economic development team.
Thank
you. Have a wonderful evening. We're going to stick around a little while longer. Item number, I believe we're back to 7, right, Madam Clerk?
Yes, sir. Item number 7, resolve approving the amended Lewiston fiscal year 26, federal fiscal year 2025 home budget and action plan for submittal to the U.S. Department of Housing and Urban Development. Requested action to adopt the resolve approving the amended Lewiston fiscal year 25, federal fiscal year 2025 home budget and action plan for submittal to the U.S. Department of Housing and Urban Development.
May I have a motion, please?
So moved.
Councilor Glant.
Second.
I think second by Councilor Harriman. And then Administrator Kainrath, do we have somebody here to kick us off? Or Ruth? Yes.
Good evening, Catherine Ruth, Community Development Manager. Very briefly, we had some wonderful news from HUD that our home budget for the consortium for Lewiston, Auburn was going to be increased rather than decreased, as we had originally heard. And so that meant that we needed to come back and see you. HUD has advised that we budget for the same amount and prepare for a decrease. Instead, we had an increase. The increase to the consortium was $33,787 for the next fiscal year, which was excellent. That makes the bottom line of the city's amended budget as $1,177,555.24. We received $16,049 of the amount that went to the consortium for our share. So the funds will go into program administration and into rental housing projects for the year. And you have a copy of the budget with a memo describing the changes. So this was a minor change, but you had voted on the original, and we thought it should come back to you for good communication and for a vote. Thank you.
Thank you so much, Manager Ruth. Yes, Councilor Chittum.
I just have to say that I continue to be in awe of your ability to wade through all of this federal documentation. This is good news, and I see no reason that the council does anything but support it.
Further comments from the council? Public comment on this agenda item. Back to the council. Madam Clerk, please call the vote.
Councilor from Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2? Yes. Word 3.
Yes.
Motion passed by a vote of 7-0.
Thank you very much, Madam Clerk. Item number 8.
Item number 8, resolve renewing and extending the mutual cooperation agreement between the City of Lewiston and the City of Auburn to maintain a consortium under the Federal Home Investment Partnerships Program for a 3-year period. Requested action to adopt the resolve renewing and extending the mutual cooperation agreement between the City of Lewiston and the City of Auburn to maintain a consortium under the Federal Home Investment Partnerships Program for a 3-year period.
May I have a motion, please?
So moved.
Councilor Chittum.
Second.
Second by Councilor Najin. Deputy Administrator O'Malley, we've had this in place now for a long time, correct?
Yes,
Thank you.
we have for a very long time.
Thank you for that confirmation.
Well,
Questions?
I believe at least 4 or 5 years.
2002.
2002, so I'll do that math quickly, 23 years.
Thank you also. Thank you, Deputy Administrator O'Malley, and thank you, Madam Clerk. Yes, comments, questions from the council? Councilor Chittum.
Thank you. I understand that Auburn gets 75% of the administrative costs because they do all 90% of the administrative work.
That is correct.
And we share 25% of the administrative costs.
Correct.
The 90% that's not dedicated to administrative, how is that divvied up between the two members of the consortium?
The remaining monies over the administrative fee are divided up equally between Lewiston and Auburn, and we have a number of projects that you've looked at over the years, DeWitt project, among others. And so Economic Development has been meeting with you, discussing different projects that will come up. So a majority of the funds are for the rental projects.
Thank you. So, not to put too fine a point on it, the amended budget that we just approved of 1.177 million, 90% of that is for projects. So 45% of it is for Lewiston projects.
That budget actually has 90% of the funding of the $1.17 million. That is our allocation of the overall budget.
Right.
And so a small amount is the administration amount, 10%.
10%?
Yeah.
All right. So half of the remainder is 45%.
Of the overall consortium,
Right.
yes.
And
Correct.
that is money that we then have in our pocketbook to spend on projects that qualify under the home.
That would be correct, yes.
Okay. Thank you.
Thank you.
Councilor Najin.
I know we've been using this arrangement for quite a while, and I think there's two questions I have. One, we probably don't have the capacity to manage the administrative actions on our side at this moment. Am I correct on that? Okay. And the second question is, what size would our municipality have to be in order to qualify for home funds alone? Do you have an idea off the top of your head?
Both Auburn and Lewiston together make up the smallest amount in order to go forward on your own. So we would basically need to be the size of Lewiston and Auburn together as Lewiston.
Perfect. Thank you.
Public comment for this agenda item. Back to the council. Yes, Councilor Chittum.
So if the economic development strategy that we heard of in item number 9 bears fruit, we could grow to be large enough to be a single member, not have to be in a consortium.
In a positive world, that would be wonderful, yes.
That was said with a little bit of humor here. I'm not certain that I want to see Lewiston at this point be 75,000 people.
Any other further comments about the agenda item? Madam Clerk, please call the vote.
Council from Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7-0.
Thank
Manager
you.
Ruth, thank you so much. We are now up to the second public comment period for individuals who did not speak at the first one.
Matthew Agrin, Ward 4. I did this out of respect for our 18-minute limit. So do we have any updates from our partner in Lewiston Housing Authority about when they plan on starting the Martell School Senior Housing Project? We were all told that the funding for Stage 1 was all set and the plan was to move forward this spring. It's still a blank lot, so no progress is being made. Our seniors have been looking forward to this housing project coming online and are waiting. I've spoken on this before, but the culture of violence that we're in here in this community, it doesn't matter if you live in Tree Street or out near No Name Pond, but we're all one Lewiston. We are made of those who have lived here since birth and those of us who came from away. But it doesn't matter where we came from, we all live here now. As such, we need to do what we can to help curb the violence that has spread here. But it's not unique to Lewiston alone. We need to before the level of violence expands, and it's not someone planned on shooting gets shot, but instead it could be your mother, your father, your sibling, or a family member who ends up being the unlucky person to catch the round that was fired, to whom it may be concerned down the road. That being said, if you know anything to stop this, please reach out to Lewiston Police Department, because they are never going to be able to solve or stop all of these issues as much as Chief St. Laurent would like. This is real life. It's not a TV show or the Minority Report movie, where psychics can predict who and where the crime will be committed, so it can be there to stop. We need the public to speak up if you know something or say something. The solution to our gun crimes is not to make government limit the legal rights to own and carry a firearm, but to make sure those caught using a firearm in a crime are prosecuted with the full ability of the legal system. Let us use the laws on the books to handle the crimes committed. Many times it's been proven if you go after the broken window crime level, you can stop bigger crime later. And finally, because it needs to be brought up, June is Men's Mental Health Awareness Month. Let's all be honest and admit there's still stigma around men's mental health, making it harder for men and boys to reach out for help. There are men who feel that people expect them to hide their emotions and man up or be strong for others. Acknowledging mental health condition is seen as a sign of weakness or a lack of masculinity among some men. According to the CDC, part of the reason that 80% of all suicides are men is because they're in mental health distress from depression, anxiety, or PTSD. Men are also more likely to use substance abuse than honest mental health care. Please talk to the men in your lives if you or them are experiencing depression.
That's time. Thank you. I welcome the public to email public comment to publiccomment@lewistonmaine.gov. Further public comment at this time. Our second public comment period is now closed. We are now up to reports and updates from councilors and/or staff. Councilor Chittum.
The 911 committee met and has still not decided on where to put the new center, either at 85 Park Street or Auburn Hall. We have just this afternoon received a memo from Director Hall addressing questions that were raised at the last committee meeting that will help us guide the decision on either side of the river as to which location will be used. But time is growing short and we need to start paying attention. I will forward that information as soon as I've digested it myself.
Councilor Soul.
Thank you, Mr. Mayor. So the Lewiston Youth Advisory Committee is having a festival on June 14th. It is called the Heart of Lewiston Festival. I can put my glasses on and read the rest. So this is going to be a free event. It's for your entire family. There's going to be games. I think there's 3 bouncy houses. Batman is going to be there with a photo booth. There's going to be refreshments. There's going to be some free food, and there's also going to be food trucks. It's for the whole family. So I hope you all come out and bring your family.
Matt, if you want to zoom in.
Thank you.
Wait a minute. Oh, there we go. Okay. Sorry, I didn't mean to interrupt you, Councilor Saul. Oh, okay. Well, sorry, I also didn't mean to.
Hold it down.
Lower it. Okay. There we go. Thank you. Yeah, go ahead.
I just hope everyone comes out and supports the youth. They are the heart of Lewiston, after all. So thanks.
Thank you very much. Further, yes, Councilor Harriman.
Thank you. So school committee met last night. Among other things, we approved a new superintendent contract with the current superintendent. We also had a great report out from Mr. Boardman and the music department, strings and bands specifically. You might have seen, it was in the Sun Journal back in October. They received a Title IV grant of about $130,000 to sort of boost their strings and band instrument library and increase opportunities for students to engage with that. And both of those programs have seen tremendous growth. I think one of them was over 100%. The other one was in the, was close to 100. So we've got lots of students who are really getting into music. We had a great little, they played us a tune at the school committee meeting. So it was great to see that. And the next meeting, we added a meeting on June 30th. So that'll be the next school committee meeting. Also, this isn't a committee update, but June is Pride Month, and Lewiston celebrates this week as Pride Week. The march and festival happened on Sunday, and there was great turnout there. And there are events happening all week. If you go to greatfallspride.org or look for Great Falls Pride on social media, you can find out about those events.
Further reports and updates?
Mr. Mayor.
Yes, Administrator Gainrath.
Real quick for the council and the public, I did extend an invitation to Lewiston Housing, the director, to join us at our next council meeting here for an in-person update, and also planted the idea to do these updates in person here on a quarterly basis for the council and the public. So I'm just going to put that out there. Thank you.
Thank you for facilitating that. Councilor Najin.
Just real quickly, to speak to some of the concerns around speeding and enforcement with speeding. So currently, there are complaints from residents on Ware Street and Pettingill Street that I'm aware of that I'm actively trying to address. I would say what we heard about Old Lisbon Road, that's another example. The challenge I think that we have right now is that we have a police department that we're asking to do many things in the city. We got 45 miles of roads, and there's still a bit understaffed. 45 square miles of space, 181 miles of roads, I believe. And so, at the end of the day, bear with us. We know it's a major concern, and it's something that we do need to address. So I just wanted to publicly state that, yeah. That's it for new business for me.
Councilor Soul.
I don't know if I said that the festival is at Samard Payne Park. So I just wanted to remind everyone. It's at Samard Payne Park, June 14th, from noon to 5. So thanks.
Councilor Roy, did you have something?
Yeah, I didn't know we were up to new business yet, but
we're heading there quickly. We're
all right,
still
cool.
technically reports and updates, but please continue.
New business. I just want to kind of throw out there what Councilor Najin said. I mean, speeding in this city is really, really out of hand, and we hear the comments, we see the emails, and like Councilor Najin said, we're aware of this and we're going to try to work on it. And I was just devastated. Like, I drove by this house on Old Lisbon Road the other day, and I could not believe, even with rocks in front of that house, how it looked. So if there's a way that we can get together with Public Works to kind of help the police in some ways, speed bumps, signs, all this stuff, let's try to make a conscious effort to have people be aware of what's going on in our town. So I appreciate that.
Councilor Gallant.
Thank you, Mayor. Seeing how we're on any other business, I attended the high school graduation. It was awesome. They did a fantastic job outdoors. Presentation, it ran smooth and fast in the sense of having 370 plus kids go through their graduation. They had a drone, so the pictures were good for no matter where you were sitting. So my hat's off to the school department for doing a really good job, especially being outdoors. And I agree with Councilor Roy about the car. I drove by that morning about an hour after it happened, and it was like, wow, and just kind of crazy. And I'd like to see if the administrator can't reach out to our tax people to find out why we can't help this lady, because if your house is destroyed and we just said that you can't live there, I would think there ought to be some kind of way that we as a city can take care of that. I really don't care what the state says. They don't tell us what to do. So see if you can't work some magic and save that lady some money. Thank you.
Councilor Roy, did you have something else?
Yes, thank you. I would agree with Councilor Gallant. I think the Lewiston graduation was amazing. Thought it was really, really good. It flowed really well. The day was beautiful. But also, again, that was my concern too, is, you know, if you have a house that's not livable due to anything you've ever done to it, I think we should be able to try to find something to do and help them out. I think that's the least we could do as a city.
Councilor Chittum.
Thank you. Some months ago, we received a report that the police department had received a grant for traffic enforcement. I'd like to have a report scheduled for an upcoming meeting from the police department about the effects of that grant.
Councilor Harriman.
Thank you. I guess as far as other business goes, I'd like to come back to the abandoned vehicle ordinance. I've had some little difficulty getting information from the police department about since their recent enforcement push on that ordinance, you know, how it's being enforced, what the purpose of it is, and I'll reach out to administration to see if I can get more information. But I'd like to revisit that ordinance because it seems like not being able to park your car on the street for more than 24 hours at a time just seems unreasonable and is not what the residents of a city who don't have off-street parking expect. So I'd just like to try to get more information about that, and I had a little difficulty.
I guess I would ask Administrator Kane-Rath if you can work with our counselor to facilitate that. Back to you, Councilor Gallant.
Thank you, Mayor. Also, I would like the planning board to work on the loitering, like they did with the needle programs. They put together something in our loitering. We have an ordinance that I think is, quite frankly, lousy and doesn't do anything. So they brought us a really nice one on this needle proposal, and give them some time. I don't expect it to have it in a couple of weeks, but I want to make sure it's on their radar. So at some point, you know, August maybe, or in September, we can have a little workshop on that, because I think loitering is a huge problem here in Lewiston, especially on our parks, people hanging out on our main streets, and we really don't, you know, I know we have no place for people to go. That's kind of, you know, but you turn them into jumpers. You tell the ones in front of the libraries to move, and they go over to that park. And then 2 hours later, you tell them to move from the park, they go back until we can resolve the big issue. But I still think we need to have the ordinance looked at and some teeth put in it where the police or someone can take care of that.
Yes, Councilor Chittum.
Thank you. I would also like to have an update on the homeless shelter, where we stand on that. Could we schedule that for a brief? It doesn't need to be a formal report, but a report to the council on where the homeless shelter stands as of today. Thank you.
Seeing no further new business, may I have a motion to adjourn?
So moved.
Councilor Najin, second by Councilor Sol. Madam Clerk, please call the vote.
Counsel from Ward 4?
Yes.
Ward 5?
Yes.
Oh, yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Motion passed by a vote of 7-0.
Madam Clerk, we appreciate having you back.
Thank you, Mr. Mayor.
Lewiston, have a wonderful night.